Ayan. Ready na. Naka-live na din ba tayo, Marion? Are we ready? Okay. So, whilst we're waiting for that, tatanong tayo ng mga students ngayon. Sino dito ang may idea about hematopoiesis? Can we define what is hematopoiesis? Ano ba yan, sir? Akala ko ba hema ang tuturo mo sa amin? Bakit hematopoiesis yan, sir? Sige, sino may idea? Raise your hand if you know, if you still remember what hematopoiesis means. Dexter. Si Dexter, Dexter, nakita ko yung email mo kanina. Yes. Ewan ko sa kanila, Sir Marco. Naku, bubula na naman yung bunganga mo talaga, Sir Marco. Ito talaga. Oo, hindi ka aabot ng New Year. Matitegi ka ng maaga dyan sa mga yan, Sir Marco. Nako. Tama ba yan, class? Magagalit. Ayan. Up na po. Okay, thank you, Marion. Okay. Alright. Si, ano muna? Si Dexter. Sige, Dexter. Pakitang gilas ka nga, Dexter. What? What? Proliferation? Red cells lang? Hindi kasama yung, no? Hindi kasama ang WBC, Dexter. Okay. Hindi din kasama ang platelets. Red blood cells lang talaga. At saka WBCs. Kayo talaga. Come naman, Dexter. You forgot that it's the production of red blood cells, white blood cells, and platelets. Diba? Diba? Go nga tayo sa next slide. Si Marion naman ang magpakita ng ano. Ayan ang definition. Okay. So there are 4 processes involved in hematopoiesis. Can anybody name the 4 in order? In order ha, in order. Class. Nako. Sir Marco, bubula talaga. Nako. Maaaga-aga ka, Sir Marco, ngayon. Patrick Noel. Sige. Okay. Renewal ng ng license? Okay. Specific tayo, ha? Okay. All right. Uh-huh. Mhm. Okay, can you show the next slide? Okay, cell renewal, proliferation, differentiation, and maturation. Okay? So isa-isahin natin sila, 'di ba? Cell renewal is from basically a stem cell. You want to change into another. Parang for example, imaginein natin si Patrick. Analogy na naman. I love analogies talaga. Ever since I learned about analogies, it makes my life a little bit easier. Okay, so let's start with cell renewal. For example, Patrick wants to be a doctor, diba? To become a doctor, he needs to study. He needs to get a certain amount of knowledge, right? So he imagine him as a stem cell, a little baby cell in either the bone marrow, or if you're an embryo, you're in the blood islands, right? So he needs signaling molecules to make him become another cell, okay? To make him become another cell. And that is what we call cell renewal. From one cell, which is a pluripotent stem cell, you become what? A colony forming unit, either a blast or a what? A megakaryocyte, diba? Diba? And then it branches off to a lot of things, which I will discuss to you guys later. Don't worry about that. Proliferation basically means it's multiplying. Okay? Humayo kayo at magpakarami, Patrick. Ganun yun. Okay? In the case of mammalian organisms, it's either through mitosis or meiosis. Okay? But in this case, it's more on meiosis. Okay? And it's more on mitosis. Okay? Differentiation, you differentiate into different types of cells naman under one specific colony, whether you're a lymphoid, you're from lymphoid origin, okay? Or you're from what? You're from the myeloblastic origin. Okay? Maturation is what? Maturing into your final form. Ayan na. Doktor na si Patrick. 'Di ba? Isa na siyang full-fledged manggagamot. Pero wait, hindi pa tapos yun. Magbo-board exam pa siya. 'Di ba? Advance ako mag-isip. So in a part of maturation is basically being tagged with something. Okay? A marker. Right? We'll talk about those markers later. Um, so you guys understand what is cell renewal, proliferation, differentiation, and maturation. Right? You will hear the words immature cells or blasts later on in our discussion. But for now, we're going to talk about hematopoiesis with it for our initial discussion or intro to hematology. Now let's move on to the next slide, Marion. Okay, the primary site of hematopoiesis in the following: an adult and fetus to infant. Okay, who here can answer? Who here can answer? Want everybody? Dexter, ayan na si Dexter. Nagpapakitang gilas na si Dexter sa akin. Dexter, go. Bongga naman ang iliac crest. Okay. Fetus. Mhm. Ay, hala. Masyado kang advanced talaga. Chill ka lang. Bone marrow lang ang tinatanong ko. Next slide tayo. Bone marrow lang ang tinatanong ko for adult. Tapos fetus to infant, anything that anybody who's less than 2 years old, you start first with the yolk sac, then the spleen, and then the liver, then the spleen. Okay? Chill ka lang muna, Dexter, okay? Pero tama naman yung iliac crest. Pero again, specific tayo, ha? Iliac crest. Pag okay, chill ka lang. Alright, next. Next. There are three phases of hematopoiesis, by the way. Don't forget the three phases of hematopoiesis. When we go back to the previous slide nga tayo, Marion. Ipapakita natin sa kanila yung previous slide. Pwede na nating masagot yung question na yan, di ba? Alright? When you go to each slide, you start first with the infant, all right? It's the mesoblastic stage or the yolk sac phase, hepatic stage, hepatic phase, and the medullary phase or the medullary stage. Go two steps nga tayo ng slide para pakita natin sa kanila kung tama ba tayo dyan. Ang sarap na pagkain ni Andrea. Oh my God, ang sarap. Parang gusto ko din makumain. Hindi pa ako kumain. Alright. Those are the phases of hematopoiesis throughout a person's lifetime. Okay? O hindi yan nag-i-stop lang. Ay, okay. Nandito na ako. Ano na ako? Baby na ako. Mag-i-stop na ako ng production. No. It overlaps. Okay? Sometimes in the clinical setting, you'd see hepatic and medullary phase occur. Okay? Within the same organism or patient na lang kasi clinical setting tayo. Right? Next slide, please. All right. When does the mesoblastic phase of hematopoiesis begin? It is on the 19th day. Okay? 19th day of embryonic development. So, hindi siya yung nag-meet si egg cell at saka si sperm cell. Hindi ganun kaagad. Hindi ganun kabilis ang mga pangyayari. Okay? Maging embryo ka muna. Okay, Andrea? Maging embryo ka muna before ka mag-produce ng red blood cells. Okay? Or your embryonic red blood cells. 19th day, okay? 19th birthday. Huwag nyo kakalimutan, nagkakaroon tayo ng debut. One day after ng debut, ayan na. Diba? Yun ang shortcut ko. Hindi ko alam. One day, nagdagdagan mo lang ng isang araw ang debut. Diba, may debut pa ba ang mga girls ngayon dyan sa Pilipinas? Nagdidibu pa ba? Is it still a thing? When I was there in the Philippines, mga kaklase ko nagdidibu pa rin eh. Alma, nagdibu ka ba? Nung 18 ka? Okay, Alma. Thank you, Alma. Dalawa pala yung Alma, sorry. Ang tatanungin ko sana si Alma Erica. Pero sige, okay lang din si Alma Maria. Charing lang. Sinacharing ko lang kayo. Kasi parang inaantok na si Dexter eh. Alright. Okay. Next slide, please. Alright. What is the origin of the progenitor cells in the yolk sac phase of hematopoiesis? Origin of the progenitor cells. Over naman. Ang lalim naman, sir, ng tanungan. Chill lang kayo. Di ba nga nasa mesenchymal phase tayo, di ba? So, mesenchymal cells siya. Mesenchymal cells. Okay? And these cells are the first hematopoietic stem cells. Okay? So, next, after this slide, I will refer to hematopoietic stem cells as HSCs na lang ha. Kasi ayoko mabubusan ng laway. Okay? HSCs na lang siya later. Okay? So after nito, last ko na yan ipapatranscribe ha. Last na yan, dapat alam na ng lahat ha. Okay? Marion, alam mo na pag sinabi kong HSC ha? Okay, clear. All right. What about sino pa ba? Yung Junakis ko, yung dalawang Junakis ko, nasaan na 'yon? Okay lang ba? Pag sinabi kong HSC, alam niyo na 'yon. Ha? Hala, hindi nagsagot si si Valiant. Nagtampo ata sa akin. Hala, tsaka si Renmar. Hindi nagsagot yung dalawa. Nagtampo. Bakit ba? Okay, okay, okay. Okay. So you guys remember when I say HSCs, it's hematopoietic stem cell and it is of mesenchymal origin. Okay? All right. Next. What part of the developing embryo do the progenitor cells migrate to? Napaka-specific. It's very specific. Actually, if you studied well or hard in your biology classes or under your freshman, I think, or yeah, in your freshman biology, you'll still remember the AGMN region, right? The AGMN region is basically a portion of the embryo that is also known as the aorta gonadonephro region or gonadomesonephros region. Okay? Or you could just say AGMN or aorta gonad mesonephros region. From the name itself, you would know that this is the progenitor of different parts of the body, right? The aorta will stem from this, the gonads will stem from this, the mesothelial lining of the kidneys will also arise from this part of the embryo. Okay? So the aorta gonad mesonephros region is the origin of life. Charing. Origin of life. No, origin of hematopoiesis lang muna. Alright, next slide please. Okay. Alright. Now, what part of the progenitor cells finally migrate to the yolk sac? OMG. OMG. Bubula talaga ang bunganga ng Sir Marco ninyo. Kayo talaga ha. Okay. Alright. Oo nga no, bakit hindi nga sila naka-on ngayon? Ayan. Okay. Nag-on sila bigla. Natakot sila. Alright. Alright. On a lighter note, let's go to ayan na pala. Okay. When the progenitor cells finally migrate to the yolk sac, what are these cells called? These are called primitive erythroblasts, and they are also known as blood islands. Do you still remember blood islands? Okay, so blood islands is another name for primitive erythroblasts. So erythroblasts basically they've already undergone proliferation and differentiation, and they're just getting ready to mature. Okay? Okay, okay. They're just about to get ready to mature. Kasi meron na siyang segment eh. Ano na siya eh. Alam natin na nanggaling na siya ng colony forming unit, erythroblast tayo, 'di ba? CFUE, 'di ba? Mamaya natin pag-usapan yung mga yarn, okay? All right. Now, what cells are found in the yolk sac? Tama ba? Ayun. What cells are found in the yolk sac? The cells that are found in the yolk sac include two cells, the primitive erythroblasts and of course the angioblasts. Okay? Show them the answer. The end product of these blast cells will form the fetal RBCs for primitive erythroblasts, or those little blood islands that you're going to see if you go deeper into analyzing embryonic RBCs or fetal RBCs rather. And angioblasts are basically your blood vessels. Okay? There we go. Angio from the word angio. Okay? So if it says angiosarcoma, or okay, so that's a cancer forming in the blood vessels. Okay? All right. Angiograph. It's basically looking at what's going on in the blood vessels. All right. Now, let's go to the next slide. I think that's a trivia question. O, di ba? Memorize ko pa. It's a trivia. Okay? Trivia. In fetal blood islands, what analytes can be measured? Ayan. Ayan tayo. Okay? This is for 1 point, Marion. Huh? This is for 1 point. What analyte can be measured? Let's go back to clinical chemistry. And, sorry, not just clinical chemistry. Let's go with hematology na lang pala para mas madali. Okay? For 1 point, bigyan natin ng motivation, Sir Marco. Kasi mahirap yung exam ko, no? Okay lang ba, Sir Marco, mag-promise ako magbigay ng additional 1 point? Mahirap yung exam ko eh. Alam niyo, Valiant yan eh. Okay lang ba? Mag-promise tayo ng 1 point? Okay lang. 1 point. Okay. Nagpaalam na ako sa dekano. Ayan na tayo. Okay? For 1 point for your next exam. Kasi talagang mahirap yung exam. Hanggang ngayon, hindi ko pa nga tapos yung case analysis. Talagang nire-research ko talaga sa medical library dito sa university kung ano ba ang ano. Mahirap yan. Alam na alam yan ni Valiant at saka ni alam na alam nila yan. Yung mga may suki cards ko yan. Mga may suki card ko yan. Alam nila yan na hindi din nila ako pwedeng i-contest. Kasi lahat ng possible na loopholes na iniisip ng mga estudyante, nasagot ko na din. Kasi isa ako dun sa mga estudyante na gano'n. Okay? So, ito ang choices natin. Ito ang choices natin, class, for that trivia question. That is for 1 point. Next, yung exam na lang ng immunology, no? Okay? So, choices natin is albumin, globulin, alpha-1 globulin. Ayoko ng alpha-1 globulin kasi baka may sumagot eh. Let's go. LDH, creatinine, and all of the above. Ayan. Ayan ang choices. Alam nyo na, after nyan, may susunod na tanong. Why? Alam nyo na din yan. Why? Hindi ko tatanggapin na +1 yan sa Hindi ko tatanggapin na +1 yan kung hindi nyo nasagot yung why. Kaya, okay. You can answer on chat, and then you can answer on the chat box. I'll give you guys 30 seconds to answer. Wait, where's my clock? Lagi ko na lang nakakalimutan yung clock ko. Okay. Lagi ko nakakalimutan yung clock ko. 30 seconds on the clock. Those who do not answer, -1. Chari! Ang sama na. Grabe naman, Sir Marco. Ang higpit natin ngayon. Kasi pinapubula nila yung buka po, Sir Marco eh. So, gumagatong ako. So, 30 seconds starting now. Okay. Globulin. Okay. All of the above, sabi ni Kim. Okay. Remember ha, fetal blood islands lang ha. Fetal blood islands lang. Hindi yung buong embryo ha. O binigyan ko na kayo ng clue ha. Okay, so yung mga hindi sumagot, -1. Stop na tayo dito. ang sama ng ugali ko. Char lang yun. Wala na, nag-stop na tayo kay Bai. Huli na ang lahat, class. Kay Bai na tayo huli. Si Bai yung huli kong nakita. Charing na. Ganun ako gumante. Ipaglalaban ko si Sir Marco. Grabe kayo kay Sir Marco eh. Charing na. Okay, last person na sumagot is si Bai. Okay, so everybody else after Bai, na ha. Wala na. Ano yung sinabi mo, Dexter, ano to? Is this the effects of dyslexia or what? Is this the effects of dyslexia or is this the effects of partying last night too hard? Sir Patrick, galing din ako ng Patrick, 'di ba? Ng ng duty ko. So wala kayong karapatan magreklamo na ganyan. Ako nagtatrabaho ako sa ospital. Charing lang, Dexter. Ini-etchos lang kita. Okay. So ang tamang sagot is globulin. Okay? Globulin. Specifically what globulin? Pakita nga natin, Marion. Specifically, hemoglobin. Okay? Kaya ako inalis yung alpha 1, alpha 1 ano, kasi it falls under the alpha 1 fraction. Now, punta tayo kay James Paul. Hi, James Paul. Is James Paul available? Hin- hindi ko ay, nanonood ng Netflix. Okay. All right. Okay, James Paul, bakit globulin ang sinagot mo? I can't understand. Even Valiant can't understand. I can see it from Valiant's face. He can't understand. Let's move on to the next contestant. Let's move on to the next contestant. Thank you for participating, James Paul. Let's go with Patrick Noel. Patrick. Patrick Star. Where is Patrick? All right, Patrick. Why did you answer globulin? Wala lang, gaya lang ako kay James Paul tsaka kay Valiant. Napilitan. Okay. All right. Well, yeah. But that's not the answer that I'm looking for. Who here can Bai, can you answer why? Where's Bai? Okay, sure. Okay, it's a little bit vague, but I'll try to specify for you. But thank you, Bai. You get 1+ for your next exam. Yes, it's a little bit vague, pero yes, we use that. We do that also. We do that in the laboratory, specifically in special hematology. For anemia of unexplained origin, specifically for a baby that has low heart rates. But yes, she does that. She has a point. But what I was looking for actually was, to be specific, is the measurement of fetal hemoglobins. Okay? Have you guys forgotten your fetal hemoglobins? Gower 1, Gower 2, hemoglobin Portland. Okay? Have you guys forgotten about that? Yes, she is correct. We want to assess what's going on with the baby. So what's going on with the embryo rather, kasi meron ng heart rate pero parang hindi nagta-thrive, 'di ba? So one of the things that they do is fetal hemoglobin analysis. Okay, or embryonic hemoglobin analysis. And that's done in special hematology, which is something that I have not seen. Hopefully I do get to see it, and I'll share the experience to Sir Marcos class when I do. Okay? All right. But essentially, it's electrophoresis or high performance liquid chromatography. Okay? All right, let's move on to the next slide. Okay, so we have three embryonic hemoglobins. I've already discussed that three with you guys. I think, if you remember, hemoglobin A, hemoglobin Gower 1, hemoglobin Gower 1, Gower 2, and hemoglobin Portland. Okay, so Gower 1 consists of epsilon and zeta chains. Gower 2 is alpha and epsilon chains. And hemoglobin Portland consists of zeta and gamma. Two of each. There's always a pair, okay? The hemoglobin molecule is comprised of four chains, always globin chains. And those chains are the ones that you see specifically for an organism that has embryonic hemoglobin. Okay, you would often hear me say the word organism because we're at the biology part of or rather the theoretical part of hematology. Okay, saka na tayo pag nagpunta tayo ng clinical hematology, saka na ako magre-refer ng patient. Okay, right now we're studying more on the theoretical part muna. Okay, now paano ko mamememorize yan, sir? Wala akong time para dyan. Sasali pa ako ng drag show, 'di ba? Valiant. Sasali pa tayo ng drag show, Valiant. Drag Race Philippines Season 4. 'Di ba? Wala akong time para i-memorize. Ain't nobody got time for that. Ganon, 'di ba? So, sasali muna ako sa meeting para madali nating ma-memorize class. Tuturuan ko kayo. And I know every year, maaalala ni Sir Marco yan, every year, lagi kong sinasabi ang shortcut. Hindi ko alam kung nagturo ako ng hematology kila Valiant. I think bacteriology kila Valiant. Bacteriology sa inyo, 'di ba? So, bago lang to para sa pandinig ni Valiant, okay? Sasali kasi si Valiant ng Drag Race Philippines Season 4. Nakasali na ako ng ano? Nakasali na ba ako? Hindi pa ako sinali. Ang sama ng ugali ng moderator natin. Hindi ako sinali. Charing. Charing lang. Hindi ko pala na-click yung join. Sorry, ako din naman pala yung may kasalanan. Ika nga ni Taylor Swift, I'm the problem, it's me. Sorry. Sorry. Okay. Alright. In the wise words of our Lord and Savior, Taylor Swift, I'm the problem, it's me. Nasaan na yung, ano? Nasaan na yung, ayan. Okay. So, paano natin yan maaalala? Gusto ko isulat yun sa papel, pero isusulat ko din para meron tayong ano. Meron tayo, ayan. Okay, join. Sana walang echo. Class, sana walang echo. Okay. Nobody's letting me in. How horrible. You guys are horrible. Charing. Okay. Okay, na-accept na pala. Sorry. Okay, so I'm gonna share my screen. I'm gonna replace Marion. Start broadcast. So guys, wag niyo kakalimutan ang shortcut na to ha. Madami na ako napapasa nito. Ang nag-memorize nito pumasa. Ang nag-memorize dito pumasa. Okay? So, goer 1, goer 2, and Portland. Okay? Easy, gay, and what's the last two? Kaya ko sinabi yung ano Valiant, yung Drag Race para hindi nila makakalimutan, di ba? Easy, gay, what's the last two? Zeta and Gamma, di ba? Zagag, di ba? Kasi you're gagging. Di ba? Di ba? Di ba? Okay? Easy, gay, Zagag, because you're gagging pag nag-ano ka pa. Kaya ko sinama yung ano, kaya sinama ko yung yung drag race na idea kasi para alam niyo na ay alam ni sir alam ko to kasi kaklase ko si Valiant noon. Okay? And pag sa awa ng Diyos nakapasa ako dahil kay Valiant. Okay? All right? Okay. Mag-present ka na ulit, Marion. Na ano na natin. Nasabi ko na easy gay, zagag. Ganyan lang lagi. Kaya gusto ko lagi on ano. Okay? Alright. Oh, ano nangyari? Alright. 'Di ba? Okay ba? Okay, Renmar? Season 7 ka, Renmar. Medyo matagal-tagal pa kasi hindi ka pa nag-train eh. Okay? Hindi ka pa nag-train. Si Valiant kasi since last year pa nagtitrain na kami niyan. Okay. All right. Next slide. Next slide, please. All right. So, what is the term used for hematopoiesis that occurs in the mesoblastic phase? Oh my God. Ang hirap naman, sir. All right. Who can answer that question for me? Just need to double check our live stream. Who here can answer that question for me? Okay. What term is used for hematopoiesis that occurs in the mesoblastic phase? Okay. Patrick? Primitive hematopoiesis. Let's see if he's correct. All right, wonderful. Primitive hematopoiesis. And this type of hematopoiesis occurs intravascularly, so within the cells. Within the blood vessels rather. Okay? Intravascularly. So don't forget about the idea about the concept of intravascular and extravascular, okay? So this concept will also apply here in hematology, and I know we've discussed it last time with immunology, right? So in hematology, it will still also be valuable form of a valuable piece of knowledge that you might use. Okay, all right. Next slide, please. When does the hepatic stage of hematopoiesis begin? Who here can answer the question? Ariane Dorothy Kiambao. Girl, child, nabingi ako child. Pero child, you destroyed my eardrums, but yes. Yes, you are correct. You are correct. 5 to 7 weeks. Can we see the answer? Actually, 4 to 5 weeks. But I think that's the update from the new book. This hasn't been updated. Let's just go with 5 class. Okay, let's just go with 5. And it usually ends after 1 to 2 weeks after birth. Okay, so let's go. You're partially correct. We'll go with the mean between the two. It's 5 weeks. Kung hindi maalala, 5 weeks, okay? 5 weeks. Yun yung pinaka-safe. Actually, I think you're using a newer book. This one hasn't been updated since I think I was a student. So please be mindful that some books may change depending on the current studies, okay, or the current edition of the books, okay. And this is from, what's that book that I used when I was writing this? I can't remember, but uh, it's the red one with RBCs on it. It doesn't make it doesn't make it doesn't it's not helpful. I'll try to find out later. Okay. All right, let's go to the next slide. Okay. What are the precursor cells that begin to develop in the hepatic stage? So you need to remember this because this was a an, I think a previous question that was asked to one of my colleagues in the past. Um, it was phrased like this: all of the following are present in hepatic erythropoiesis except for, so you'll see these three cells: erythroid precursor, monocytic precursors, and granulocytic precursors. Those are the three things that you will see. Okay, next slide. Let's show them if we're correct. Yes. Okay. So those are the three cells that you might see in the exam. That's the question that you might see in the exam, and those are the three precursor cells that may occur. So you could they could change it into, I don't know, normoblast, and then they'd say monoblast, and then they'd say stab cell. Okay. So those are precursor cells. Remember, those are precursor cells. We haven't gone to the maturation series yet. There's a there's a lecture for a different slideshow for that. But please don't forget, erythroid precursors are different. Those are the ones that start as monoblast, and it becomes a mature RBC with a donut shape or with a biconcavity. Okay, monocytic precursors, from the name itself, it becomes it's a monoblast that goes and mature to become a monocyte. Granulocytic precursors, eosinophilic erythroblast, what do you call this, leucoblast, let's go, mahirap kasi tatlo siya eh. But again, its end products are the eosinophils, basophils, and neutrophils. Okay, now let's go to the next stage of hepatic, or rather the next phase of the hepatic stage, which is the lymphoid blood cell production, or lymphoid precursor production. This occurs in the kidneys and the liver. There's two organs that produce lymphoid cells in the hepatic stage, or hepatic hematopoiesis. Okay? So don't be confused, okay? We have the mesenchymal stage, we have the hepatic stage, and then we have the medullary stage, okay? So for a fetus for the fetus who's still getting ready to produce blood cells, B lymphocytes are produced in the kidney and the liver. Once those organs are present, B lymphocytes begin to mature in the liver and the kidneys. Look at it. B lymphocytes, sir. Akala ko sir sa ano? Akala ko sir sa bone marrow siya. Kaya nga B lymphocytes, sir eh. No. Hepatic stage muna tayo. The bone marrow hasn't yet fully developed. That's why there are other cells or other organs that compensate for the lack of maturity of the bone marrow. Hence you have the liver and the kidneys that will produce the B lymphocytes. But the thymus is still the production site for T lymphoid cells. Okay? Or rather the mature lymphocytes. All right? Move on to the next one. When does the medullary phase of hematopoiesis start? It starts at the 5th month of fetal development. Okay? This could be updated depending on what book you're using, what edition of the book that you're using right now. But so far, I did a Google a quick Google translate after our discrepancy with Arian earlier. Okay? So far it's still the same according to Wikipedia. According to Wikipedia, it's still the same. Okay? Now, let's move on to the next slide. Now, after birth, how many months does it take before the bone marrow becomes the primary site of hematopoiesis? Okay? This is an anatomy and physiology question. I know there's a slim chance that this is going to be asked in your board exams or even in your AACP certification exams. But I did add it there just for your information. It's at the 7th month of life. Okay? It's at the 7th month of life where it shifts from hepatic stage to medullary stage. Okay? Okay. Clear? So I will pose a question again. I'll ask a true or false question. True or false? Alam nyo na, i-explain nyo sa akin kung bakit na naman at the end. Hindi lang basta sasagot, okay? Alright? True or false? All false. Teka lang, lagyan muna natin ng line. Yan na yung line natin. True or false. Lagyan muna natin ng line. So, when one part of the body starts hematopoiesis, does the other parts of the body capable, open and close parenthesis, capable of hematopoiesis stop producing blood cells instantly? Ayan. Okay? You guys have 30 seconds to answer that question. When one part of the body starts hematopoiesis, does the other parts of the body, open and close parenthesis, capable of hematopoiesis, stop producing blood cells instantly? True or false? You only have two choices. Diba? Ang dali-dali ng question. Pero bakit kaya sila nagtatagal? Bakit kaya sila nagtatagal? It's either true, it's either... Kasi, I will ask why. I will... Okay. 30 seconds is up. We'll stop with Andrea Luciano. Okay? Anybody else after Andrea Luciano are not eligible to be asked a question, and you won't have a chance to prove your answer to me. Let's go again with Bai. Si Bai na naman. Ano ba yan, sir? Kasi meron ako ditong app na draw numbers. Random number generator. ikaw ang tinamaan ng random number generator. Why did you say false? For you. Okay, for you. Okay. Ayun na nga yung question. Kinakabahan ka ba sa akin, bay? Chill ka lang. Huwag ka matakot sa akin, bay. Yan na, nagtagalog na ako. Okay. 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 Yeah, close. All right, let's go with somebody who I haven't called yet. Sydney Louise Ricabo. I like her name. I want to visit Sydney, Australia. That's the only reason why I called you. Hi, Sydney. Okay, that wasn't the idea of what I was asking you. Let me repeat the question. When one part of the body when one part of the body starts hematopoiesis, does the other part of the body capable of hematopoiesis stop producing blood cells instantly? Tatagalugin natin, Renmar. Renmar ha, tatagalugin natin Renmar. Parang mali yung idea ni Bay at saka ni Sydney. Parang sinasabi nila nag-stop. Kagad sabi ko pag nag-start, okay? Pag nag-start na, for example, Renmar, fetus ka, naiiri ka na after 7 month of life mo, 'di ba? 7th month of life mo na. Ibig sabihin, magi-start ka na ng bone marrow production mo. Expected na natin na mag-start ka ng bone marrow production. Magi-stop na ba ang hepatocytes mo and your residual blood islands kung meron man natira agad? Yun yung ano ko, yun yung question ko. Mali yung naintindihan. Mali ata yung pagkakaintindihan. Class ha, reading. Reading is one of the core concepts of one of the core subtests of IELTS. May balak pumunta sa ibang bansa ha. At saka pumasa ng exam ko. Kailangan ninyo magbasa ng maigi. Okay? Mali yung idea nila eh. Okay? So, Renmar, false ang sagot. Tama ang false. Yes. Pero please explain to me why it's stop. Why it's false rather. Yes, that is the word that I'm looking for. Correct. There is continuity. They overlap with each other. Very good. Very good. You have a good understanding of what happens. Very good. Kasi hindi naman fully mature, 'di ba, ang bone marrow ng isang bata. 7 months old, 7 months old ka, naiiri na kita, Renmar. Ano na kaagad, mature na kaagad ang bone marrow mo, 'di ba? It takes some time, maybe years, 'di ba? Or decades for some people with different diseases. Very good, very good, very good. The he understands the concept clearly. Naintindihan, Valiant? Syempre, tinatanong ko yung mga kabeks natin. Tinatanong ko yung mga kabeks natin kasi ayoko ng pretty lang. Valiant ang angulo na yan. Hindi ko gusto yung angulo na yan, Valiant ha. Mas gusto ko yung angulo last time. Hindi maganda yung camera positioning natin ngayon, Valiant. Okay. All right. Renmar, very good. Okay, let's move on. By the way, Marion, please add the point for Renmar. He understands clearly what's happening kasi nga syempre iniri ko siya. 'Di ba? On his 7th month of life, sinabi ko sa kanya, anak. Okay, anak. Hindi ka pa mag-stop sa hepatocytes, yung hepatocytes mo ha. Huwag mo munang patigilin yung hepatocytes mo. Okay? All right, let's move on to the next slide, please. Okay, so yeah, that is okay. So our next question is: what hematopoietic factors are present in the serum at the start of the medullary phase? Naku, hematopoietic factors naman ngayon to. So you're going to memorize a lot of what do you call this? A lot of acronyms. And we're going to start with EPO. What is EPO? Who knows what the meaning of EPO? Ayan, taray talaga si Mark Segi. Buhay pa pala si Mark Segi. Nabuhay si Mark Segi. How are you, Mark Segi? Ay, mabuti naman at ako ang nakagising sa'yo. I'm sorry. Please transcribe EPO for me. What is EPO? Okay. Where is the origin of EPO? Where does it come from? Bibigyan kita ng choices. Gusto mo ba? Oh, ayan ang choices mo. Oh. Erythropoietin comes from which organ? By the way, class, this is a question that is usually asked in the word exam. Where does erythropoietin come from? It could not. We may not be asked in hematology, but it could be asked in clinical chemistry. Okay, very good. Arian answered correctly. Kidney. Okay. Tagal mo Mark eh. Nagigigil sa'yo si Arian eh. gusto ni Arian mabilis ang sagutan, ha? Ayaw ni ano na. Oo. Okay? All right. Now, let's start with hemoglobins that are present in the serum at the start at the start of the medullary phase. Okay? At the start. Ibig sabihin, kakairi ko pa lang kay Renmar, 7th month na niya sa mundong ito, okay? Kakairi ko pa lang kay Renmar, ano ang makikita nating mga hemoglobin? May nagtaas ng kamay. Who is that? Lilzo. What are the hemoglobins present in your blood or in your serum at the start of the medullary phase? Very good. Very good, very good, very good. So there's still so for example, Lil Zo, since you answered the question for 1 point, which one of the three hemoglobin variants do you think is the most abundant at the start of the medullary phase? Wrong. Okay? I even emphasized the word at the start of the medullary phase. Ibig sabihin, kakairi ko pa lang. Kakalabas pa lang niya. Hindi pa siya nakaka 1 years old. Hindi pa siya nakaka 2 years old. Naka 1 years old. 1 year old. My God, sir. Akala ko ba nagtuturo ka ng English? Nagkamali ka ng 1 years old? Alright. Okay. Arian, James Paul. Ayoko kay Arian. Hindi ba kapag-antayan si Arian eh. James Paul. Ana? F what? F what? Oh, hemoglobin F. All right, wonderful. Thank you so much. Yes, wonderful. So if you're a newborn, obviously we're going to expect a lot of what? We're going to expect a lot of hemoglobin F at the start of the medullary phase. Remember, ha? Remember yon. Be specific with the Gracie. Why did you raise your hand? Oh my gosh. Naku, nakakatakot to. Ano kaya ang itatanong ni Gracie? Gracie, what's your question? Ay, napindot ko lang. Ayun na naman tayo sa napindot ko lang. Okay. Alright, let's move on to the next slide to see if we're correct. Okay. So, EPO is basically GM, CSF. EPO is one of the substances, or rather analytes, that you will see in the serum of a patient that has just started the medullary phase. We also have those CSF. Sir, may CSF sa loob. Hindi yan CSF. It's colony stimulating factor, class. It's colony stimulating factor. Granulocytic monocytic colony stimulating factor and the granulocytic colony stimulating factor. From the names itself, I think you can deduce what type of cells it's going to produce, right? EPO starts with the production of RBCs. The GCSF solely is responsible for the production of what? The end product of this is a signaling molecule for the production of, or rather the stimulating factor for granulocytes only. So eosinophil, neutrophil, basophils. GM monocytic is granulocytic monocytic, meaning it is combination of granulocytes and monocytes. Okay? Is that clear? Clear? Gracie, clear? Okay? Aksidente ko lang ding tawag ang pangalan mo, Gracie. Sorry naman. Okay, next slide. All right. So I think this was a question that I asked earlier to Lil Zo. Masyado akong advanced mag-isip. So I think we already know the answer, right? Can we move on to the next slide? So the answer to what hemoglobins are present in the serum at the start of the medullary phase, you'll see hemoglobin F, hemoglobin A1, hemoglobin A2. Okay? Let's move on to the next slide. In adults, the primary site of hematopoiesis is where? Very easy. Patrick. Napapansin ko, Patrick, parang ano? Patrick ha? Patrick, parang napapansin ko yung mga easy questions sa mga sinasagot mo agad ha. Pag mga mahirap na mga heart-wrenching questions sa mga tinatanong ko, hindi ka na, bigla kang tumatahimik. Ha? Mamaya ka sa akin, Patrick. All right, let's move on to the next slide. He is correct, by the way, class. Oh yeah, I forgot to add. I forgot to say. Please add the point to James Paul earlier for answering hemoglobin F. Okay. All right. Now, let's move on to the next slide. What is the importance of lymphoid tissues in hematopoiesis? All right. So secondary, we have primary lymphoid organs and secondary lymphoid organs. Okay. So before we start the answer, before we start answering the questions, what are your primary lymphoid organs? That's the reason why I didn't explain this further last two meetings for immunology and blood banking, because I know I'm going to discuss this one to you guys. So I omitted that part of the discussion with you. So from the previous week. Now I'm going to ask the question in this one, in this particular discussion, because I know for a fact that I'm 90% sure that they're going to ask this in the board exams. They're going to put it here in hematology. Now, let's start first with your primary lymphoid organs. What are your primary lymphoid organs ba, Sydney? Sydney. Alright, thank you. Now, dun sa mga nagtaas ng kamay, tatawagin ko naman kayo ulit. Secondary lymphoid organs naman, Gwendolyn. Can you give me your secondary lymphoid organs? Okay. Meron ba tayong... Bongga. I love it. Correct. Okay. Alright. Okay. Now, what is the importance of lymphoid? Ay, meron nga pala tayong clap emojis. Guys, mag-clap naman tayo para dun sa mga nagsagutan. Kayo naman, guys. Ano naman ganon? Hindi ako maniwala dun sa color skin tone ni Patrick. Hindi ako maniwala sa skin tone mo. Patrick, hindi ako maniwala sa skin tone ng emoji mo, ha? Alright. Very good. That's correct. That is correct. Okay? Now let's show them the chart that I have there for you guys. So primary lymphoid organs function in hematopoiesis in different way, in a very different way when it comes to primary and secondary lymphoid organs rather. So the primary lymphoid organs, they're responsible for the maturation. Just for your information, T cells mature in the thymus, B cells mature in the bone marrow. Okay? Secondary lymphoid organs, they make the cells immunocompetent. These are basically the battle zones. Kaya nga, di ba yung unang namamaga yung mga secondary lymphoid organs? Nagkakaroon tayo ng mga kula-kulani. Gets nyo? Pansin nyo yun, Patrick? Di ba? Nagkakaroon ka ng tonsillitis kapag ka nagkaroon ka ng ng infection sa tonsils mo, di ba? Kasi that's a lymphoid organ. Right? So, okay. Let's move on to the next slide. Okay, what are the types of marrow tissue? Oh, this is a question in the board exam. There are two types of marrow tissue. Remember? James Paul, do you still remember your marrow tissue? James Paul, you raised your hand. I'm sorry. You're asking me a question when I was asking you a question. I'm sorry, James Paul. James Paul. All right. So, okay, Gwendolyn, do you still remember the types of marrow tissue? Which of the two, Gwendolyn, is inactive? Oh my gosh, nag-disappear si Gwendolyn. Let's move on to Mel. Mel, it's so nice to see you, Mel. Mel, good morning, Mel. Alright. Wala man ng good morning dun sa iba. Kayo talaga ha. Grabe kayo ha. Ibang level na talaga ang mga students. Charet. Very good. Yellow marrow is the inactive form. Alright. Let's move on to the next slide. Okay. That is correct. Red marrow is the active marrow, meaning when you say the word active, that basically denotes the hematopoietic activity. Okay. Yellow marrow is the inactive one because it's basically just fat cells. Okay. Kaya nga 'di ba mataas ang cholesterol ng ano class ng bulalo. 'Di ba? Kasi 'di ba bulalo has what? Buto. Oh my gosh, na-miss ko na. Gusto ko nang umuwi ng Pilipinas. Mark Segi, lilibre kita pagka ano ha. Pagka uwi ko ng Pilipinas ha. Lilibre kita. Kakain tayo ng bulalo. Pero tatlong ano sa'yo. Tatlong tatlong malaking bowl ng bulalo yung sa'yo, Mark Segi ha. Okay? Alright. Pag hindi ka nabigyan ng suki card, ha? Pag hindi ka nabigyan ng suki card, ililibre kita. Okay? Pag umuwi akong Pilipinas. What bones have active marrow? Sama na natin si Marion kasi ano. Okay? Ayan. Ay, ang galing talaga. Oh, hindi ko na kailangan sabihan. What bones have active marrow? Alright? So, what bones have active marrow? Ayan ang mnemonic ninyo, RSVP. So, ano yung RSVP? Kaya ako nga in-invite, di ba, si Mark Segi ng ano. Kasi kailangan na niya mag-RSVP. Oh, di ba? Di ba? Ang witty naman ni Sir, biglaan. Ang bilis naman kaagad. Kailangan na niya mag-RSVP kung papayag siya or kung kukuha siya ng ano, di ba? Okay? So, what does RSVP mean? Actually, there's 3 S's there. Ha? Huwag niyo kakalimutan yung 3 S's. Okay? Rib, sternum, skull, scapula, vertebra, and the pelvic bones. Okay? Those are the sites of bone marrow. But, somebody said earlier that we can collect bones from the iliac crest. Saan ba yung iliac crest dyan sa mga yan? Anatomy and physiology review tayo. Sige, anatomy and physiology review. Saan ba ang iliac crest? Nandoon ba yan sa ribs? Nasa sternum ba yan? Nasa skull ba yan? Baka naman kukuha tayo ng bone marrow sample sa foramen magnum ninyo. Saan ba yung iliac crest na yan? Patrick, pelvic bones. Okay, very good. It's in the pelvic bones, okay? So, ano ka muna, magpo-post ka muna ng ano. Valiant, nasa kagagawin kitang example. Nasaan si Valiant? Valiant, are you there? Wala, si Renmar na lang. Nasaan si Renmar? Okay. Renmar, ayan. Ay, si Valiant, ayan, si Valiant. Valiant, tayo ka ng, ano, atras ka lang ng konti. Tapos, kailangan makita namin yung shoulders mo. Ayan, yung kailangan lang makita yung shoulders mo, yan. Mag-post ka kung paano kukuha na ng, ano, ng bone marrow sample. Ganyan ka lang, hoy. Sasampaling kita. Sasampaling kita. Sasampaling kita. Paano ka kukuha na ng bone marrow sample? Pakita mo sa class. Imagine niyo nakahiga siya. Ayan. Ayan, tatagilid siya. Okay? Tatagilid siya. Ngayon, kung imagine niyo lang sa baba, okay? Imagine niyo lang sa baba, naka ano yung puwitan ni girl. Okay? So, somewhere dun sa area na yon. Ang halay ni James Paul ha. Wag ganon, James Paul. This is a family-oriented show. You guys will be seen. This lecture will be seen by all over the world, even in Zimbabwe. My goodness. People who are studying hematology in Zimbabwe will see this. Walang kahalayan, James Paul talaga ha. Nandyan pati ang girlfriend mo, James Paul, nakakahiya. Sabihin nanunood ka ng kabadingan. Okay. All right. Let's move on to the next. Let's move on to the next slide. Differentiate the bone marrow of the following: an adult, and a child. Child. All right. So I will ask somebody a question. What's the difference between the two? Um, who here can answer? Taray talaga ni Patrick. Kung mapapakitang gilas talaga si Patrick. Patrick, ha? Alright. Patrick, what's the difference between bone marrows? Between the bone marrow of these two patients? Okay. Give me a number. Mm-hmm. Bigyan nga natin ng point yan si Patrick. Ang taray ni Patrick, alam niya. Pakita natin kung tama ba ang sagot. 50-50. Very good. You are correct. Ang taray talaga. Parang si Mark Segi lang yung mo, big fan mo. Wala ba yung iba nating classmates dyan? Ba't si Mark Segi lang? Tsaka si Zabedi lang, nakita ko. Ayan, class. Thank you so much. Dapat binibigyan nyo ng yung classmate ninyo. Ng papuri, di ba? Alright. Next slide. Okay. Besties. Taray na besties. Naloka ako sa inyo. Di ba dapat si Valiant ang may bestie dyan? Parang kakaiba pag lalaki. Ang weird. Alright. Now, what is the term for the numerical comparison of granulocytic precursors from erythrocytic precursors in the bone marrow? That is what you call the myeloid erythroid ratio, if you're not mistaken. If you're not yet familiar with it, the myeloid erythroid ratio is one of the questions that popped up in my board exam in the hematology section. Okay, the hematology section, they asked me a question: what is the normal value of the myeloid of a myeloid erythroid? A normal myeloid. What is the normal value of a myeloid erythroid ratio? That's the only question that they asked me, and they didn't give me a range. They gave me exact numbers. They gave me 1:1, 1:2, 2:1, and then 1:20. What do you think is the correct answer? Bye. Very good. Very good. Very good. Now, let's see the normal value. Okay. The myeloid erythroid ratio has a normal value of 2:1. Binaliktad nila ako, niluka nila ako. Actually, naalala ko yun, mali ang sagot ko doon. naalala ko yun. Naalala ko yun. Ang sinagot ko 1:2. Kasi ang naalala ko sa school yung 1 and 2 lang ang naalala ko. Hindi ko naalala na, ay oo nga, yung myeloid fraction. So, wag nyo akong gagayahin, class. Gayahin nyo si Bai. Bai ha. I forgot to say salam alaikum to Bai pala. Salam alaikum, Bai. Okay. Let's move on to the next one. Yellow marrow is also known as the active marrow. It is capable of reverting back into the active marrow in what cases? It's inactive, but it's capable of reverting back to it, meaning it can turn into active marrow or red marrow. In which cases? Well, when there is excessive blood loss or acute blood loss anemia, okay? And then excessive blood cell destruction. Those are the two cases. Can you give me a case where there's excessive blood loss or not blood loss? If I chopped off Patrick's hand, he'll undergo traumatic anemia or hypovolemia basically, and that's excessive. That's gonna cause excessive blood loss if that doesn't get patched up. But I want to see if people have actually remembered their anemia. What type of anemia? Give me an anemia that causes excessive blood cell destruction or rather red blood cell destruction. Sige nga. Marami, pero gusto ko lang makakita kung sino ang nakakaalala pa ng anemia nila. So that's our next topic. Next topic after our intro to hematology. Sige. Walang magsasagot. Ay, tare, Lil Zo, sige. Very good. Can you give me an example of a hemolytic anemia? Taray, ayan na nga ba, sir? Sabi ko na nga ba, may follow-up question eh. But you are correct. Hemolytic anemia causes blood cell destruction, hence the term hemolytic, meaning it's destroying the red blood cell. Okay? Lysis. Give me an example of a hemolytic anemia, Lil Zo. An example of a hemolytic anemia. Patay. Wala nang naalala. Okay, bigyan ko kayo. Marchia-Faba-Michelli syndrome, also known as paroxysmal nocturnal hemoglobinuria, caused by Donat-Landsteiner hemolysins. Have you guys forgotten about that? Do you still remember? James Paul is saying, but let's go to the very basic. Paroxysmal nocturnal hemoglobinuria. Do you still remember that one? Okay. Wala talaga nakaalala. Nakita ko sa faces nila. Medyo dumbfounded yung mga students. We'll go with that one by one. Don't worry, bye. Iisa-isahin natin yan, bye. Pagkalabas mo na, pagka-exit mo sa Google Meet natin, bye. Every time na makakakita ka ng anemia question, ay, alam ko yan. Ay, alam ko yan. Gaganon yan. Gaganyan yan. Parang ako nung student ako natapos ako na review kasi. Ay, tanawa ba ya? Alam ko na yan. Oh, 'di ba nagbisaya pa da. 'Di ba? Tanawa, alam ko yan. Oh, 'di ba? Ganon. Okay? Ganon na ganon ako nung estudyante ako eh. Okay? So, let's move on to the next slide. Okay? What specific part of the bone marrow is associated to hematopoiesis? So, ano ba yan? Bakit kailangan may mga specific pa? Okay? We're talking about the hematopoietic cords. If that's asking the hematopoietic cords, basically from the name itself, hematopoietic cords, mukha talaga siyang cords sa loob ng bone marrow. Literally, it's like a cord. The hematopoietic tissue is separated from the central blood supply by what cells? By adventitial cells. Okay? Ngayon, magdo-drawing na ako mamaya-maya. Okay? Right? Kasi hindi natin ma-imagine yan kapag yan lang, 'di ba? So, specific part of the bone marrow, you guys need to remember hematopoiesis occurs in the hematopoietic cords, or you could say cords only. Okay? But we're talking about the blood tissue, or the hematopoietic tissues are separated from blood supply, from central blood supply in the bone marrow. That's what you call the adventitial cells, or the zona adventicula in a tissue of in a cross section of the bone. Okay? All right. Let's see if I'm correct. Okay, hematopoietic cords, which is separated by adventitial cells found in the zona adventicula. I'm not gonna add that one. That's just additional information that may be needed, but that may not be important for you guys. But just for you guys to understand what I'm talking about. All right. Now let's move on to the next slide. The precursor cells are present. What precursor cells are present in the following sites in the cords near the adventitial surface? You'll see megakaryocytes and normoblasts. Okay, what cells or fragments do megakaryocytes produce? Basics tayo ah. Huwag niyong pabubulain yung bunganga ni Sir Marco. What happens to megakaryocytes after it gets expelled out of the bone marrow? Class? Walang tao. Hala, class. Megakaryocytes. What product or the end product of, binago ko lang yung tanong ulit. What is the end product of megakaryocytic production or megakaryopoiesis? Patay. Pag na-realize ko, Sir Marco, pag binago ko yung line of questioning ko, naluluka na sila. Hindi na sila nakakaano. Oo, napansin ko. Pag binago ko yung line of questioning. Okay. James Paul. Oo. Ano po? Okay. What's the other term for thrombocyte? Bongga si James Paul, no? Taray, platelets, 'di ba? Megakaryopoiesis is the production of megakaryocytes which eventually ends to produce what? Platelets, 'di ba? Platelets. Normoblast, alam niyo na, RBCs, 'di ba? Ang end product niya, 'di ba? Now, deep within the cords, can we go to the next slide? Deep within the cords, you'll see granulocytic precursor cells. Okay? Granulocytic precursor cells. Isa-isahin natin yan, guys, pag pinag-usapan natin. Tingnan natin yung anemia at leukemia. Okay, wag muna ngayon. Masyadong ano pa. Masyado pang bata ang ano. Hindi pa. Nahirapan na nga sa megakaryopoiesis, di ba? Okay? Next, let's move on to the next slide. Up to what stage of the myeloid series can be found deep within the cords? Kailangan pa yan, sir? Oo, mga tinatanong yan. Mga ano to, mga, ano tawag doon? Recall questions to. I know, when I was studying this, I was like, oh my God, do I really need to remember this? Yes. Okay, so up to what stage of the myeloid series can be found deep within the cords? It's actually the metamyelocytic stage. Okay? And do you know what's special about the metamyelocytic stage? Diba? What's special about the metamyelocytic stage? Aside from it being the third cell before it becomes a fully matured granulocyte or neutrophil. What's so special about it ba? Do you guys still remember? Ang makakasagot, merong 2 points. James Paul. Parang si James Paul lang ang nag-aaral ah. James, oh, ginugel mo lang yan, tapos tinagalog mo. Next. Next. They are immature blood cells of white blood cell origin that are what? That are what? Little Zoe. Nakalimutan na nila na bubula talaga bunganga ni Sir Marco. Ano na? O, isa-isahin na. Sino na lang dito muna? O, sige, isa-isahin natin. Para baka nakalimutan nila na kasi eh. Let's go to the maturation series na lang ng ano. Hindi ko pa dapat ituturo pero sige. Let's go to the maturation series. Sino makakasagot na for 1 point? Who can answer me the order of the WBC maturation series from a stem cell? Grabe naman. Grabe naman, sir. Hanggang stem cell. WBC sa alam ni Valiant yan pag ako nagtanong specific. Alam ni Valiant yan. Wala makakasagot. Bigyan natin ng 1 minute ang mga students kasi 2 minutes kasi inom din ako ng tubig. Sige, pagbabalik ko uminom ng tubig ha. Dapat may makakasagot. Ano gagawin ni Sir Marco? Hindi ko alam. Okay, class. Okay, class. Sino na makakasagot sa akin ng in order the maturation series of WBCs? Nga. Ayoko na kay James Paul. Kay Gwendolyn naman tayo. Mamaya ka na James Paul sorry. Bakit try? From stem cells ha? From stem cells. Mhm. Aha. Mhm. Okay, pakiulit without looking at your notes. Patay. Masyadong specific but very good. Very good. Pakibigyan ng 1 point yan. Very good. Lagi sila nagtatry, no, Sir Marco? In fairness, tama naman. But without looking at your notes, you start first with the stem cells, the pluripotent stem cells, colony-stimulating factor, CFU, CFE, CFGM, tsaka M, di ba kanina? And then you become a myeloblaст, right? Then what else? After myeloblaст, you become what? Ano na, nakalimutan na. Huwag niyo masyado kung ano yung sarili niyo dyan. Wag muna, may yellow blast muna. Hoy, chillax ka lang. Chillax ka lang. May yellow blast. Ano sunod? Pro may yellow. Ano na? Sige nga, James Paul, tulungan mo nga siya. Oh, go. O yan, sige, tulungin mo. Mm. Tapos? Mm. Ayun. Okay. Okay, very good. Band neutrophil, eosinophilic precursors. Kaya tinatanong ko kanina, what's so special about What's so special about metamyelocyte? It's a cell before a cell becomes segmented, 'di ba? Before siya maging segmenter. 'Di ba? It's the cell before it becomes segmented or segmentation becomes starts. Kasi nga siya na yung may kidney bean shape. Okay? So yun lang naman yung tanong ko. Haba ng sagot ni Gwendolyn, no? In fairness kay Gwendolyn, complete. In fairness, tama naman si Gwendolyn, pero kaya ako tinuturo sa inyo yung shortcuts kasi exam na tayo. Alam na ninyo dapat yan, di ba? Dapat idea-wise, alam na ninyo na ang sunod-sunod ng series. Okay? Yun yung reason kung bakit ako nandito sa harap ninyo, kung paano ninyo sasagutin yung mga questions sa exam. Hindi yung theoretical portion kasi tapos na kayo dyan, di ba? So, start tayo ulit. Myeloblaст, 'di ba? Myelocyte, 'di ba? Ay, ano ba? Myelocyte, metamyelocyte, stub cells, and then a specific segmenter, 'di ba? When I say segmenter, ano siya? Neutrophil, eosinophil, basophil. Ganun lang ang tatandaan, 'di ba? Mabilis 'di ba ang sagutan? Sinabi ko hanggang stem cell, ulitin natin hanggang dagdag nyo lang sa dulo yung stem, sa unahan ng stem cell. Ganun lang yung ibig ko sabihin, Gwendolyn. kaya, kaya tinanong kita without looking at your notes. Can you answer? Kasi mahirap ma-memorize yung chart na yan. Girl, ako ngayon nakatapos na madami ng medtech ang nakatapos ng pagme-medtech. Naging ano na sa mga field nila. Pero ang hindi nila alam hanggang ngayon is yung binasa mong chart. Okay? Alright? So, dapat tayo, test-taking skills ang tinuturo ko sa inyo ngayon. Okay? Alright. Okay, next tayo. So up to what stage it can be found deep within the cords? That is metamyelocytes. Okay? Normally, you will not see metamyelocytes in the blood. Okay? Okay? In the peripheral blood because that's the last stage that you will see in the cords. Okay? Yan ang you will not see a band cell. You will not see a band cell in the bone marrow dapat. Okay? Or you'll see only a few amounts of band cells. Okay? Because karamihan nandun na sila sa peripheral blood. Okay? Or segmenters rather, not band cells. Segmenters. Okay? All right, let's go. Let's move on to the next uh, slide. How does a precursor cell exit the cords and get into the bone marrow? Basically, it moves through what? It moves through the adventitial cells. I think I will see a chart here. Can we show the chart? So it goes to the it makes contact with the adventitial cells to allow passage, not contract pa, contact yan. Adventitial cells contact and allow passage of mature cells to the endothelial surface. The endothelial cells detect specific receptors that allow the passage into the blood vessels into and the surrounding cords. Okay? So each cord is you imagine a cord like a root, 'di ba? Para siyang alam niyo yung blood supply ng kidney ninyo. Kung nag-aral kayo ng clinical chemistry ninyo in the anatomical with the anatomy and physiology in mind. 'Di ba each nephron is surrounded by blood vessels. Parang isa siyang isang line tapos may mga sanga-sanga ng blood vessels na nakasurround sa kanya. Ganun ang itsura ng mga cords na yun. Kasi that is the place where adventitial cells allow passage of the mature cells to the endothelium of the blood vessels. Okay? So I'll show you guys a drawing of that later. We just need to remember the receptors first. Okay? Para mas klaro sa inyo. Isa-isahin muna natin itong slide na to. Okay? Now, let's move on to the hematopoietic microenvironment. I think that's the next slide. Yeah. Now, the hematopoietic microenvironment is important because, next slide, because the stem cell differentiation and proliferation occurs because there's a balance of chemical signals in this part of the bone marrow, or rather the hematopoietic cell, or site of hematopoiesis rather. It's important for the stem cell. Okay? The maintenance of the microenvironment is important. Okay? For the stem cell. Now, next slide. The hematopoietic environment is composed of what cells in the bone marrow? There's a lot actually. Endothelial cells, adipocytes, reticular cells or fibroblasts, macrophages, osteoblasts, and osteoclasts. Okay? Let's go at them one by one. Next slide. Endothelial cells basically serves as the what? The gate for the mature cells to get out of the blood vessels. Okay? Adipocytes are basically the cells that provide nutrients or the hormonal signals or the chemical signals for the stem cells to mature. The reticulocytes or the fibroblasts provide the cage for the cells or the whole skeleton or a frame for the bone marrow tissue. Okay? Macrophages are there to remove any impurities or remove any cells any cell in the microenvironment that is abnormal. Okay? Kaya nga, antigen presenting cells detect something that is foreign within our body. I asked you guys a question last week, right? Do we have foreign cells? Any type of mutation can be detected by bone marrow macrophages so that it doesn't go out of the bone marrow microenvironment. And the osteoblast and osteoclast, sila yung parang mga workers. Sila yung nagtatayo ng buto natin. Okay? Nagbabawas, osteoblasts produce the bone cells, okay? The outer cage or the outer mainframe. The osteoclast basically sculpts it. Parang ganun yung description niya nung binasa ko to sa anatomy and physiology. So nagkakaroon siya ng shape because of ang bones natin nagkakaroon siya ng shape because of the programming, the genetic program inside the osteoblasts and osteoclasts. So again, that's another discussion for histology, and that is something that will not be involved in your discussion. Okay? Now, let's go to that one. The next slide rather. The importance of endothelial cells in the hematopoietic microenvironment, as I mentioned before, these are the gates. Kaya nga it regulates the flow of particles and in the hematopoietic spaces. Right? It regulates the flow of particles. Kaya nga siya ang gate. 'Di ba? Gate din siya ng labasan ng mga mature RBCs, WBCs, or platelets natin. Okay? It also causes the explosion of megakaryocytes, or rather the expulsion of megakaryocytes into fragmented segments known as platelets. Okay? Now, let's go to adipocytes. Adipocytes are important because of what? Because it provides the steroid compounds. Yun yung sinasabi ko. Two things. It provides steroid compounds that can affect hematopoiesis, the chemical signals, and it provides and regulates the volume of the bone marrow, okay, during active erythropoiesis. Okay, let's move on to the next one. The importance of macrophages, as I mentioned before, they destroy foreign particles, or they phagocytize foreign particles. They release cytokines that can also affect hematopoiesis. Okay? Vague lang in description ko kanina. Okay? There are also another type of cells that can be found in another type of cell that can be found in the microenvironment. Let's go to the next slide. These are known as stromal cells. They originate from fibroblast or reticular cells, and their main function is to bind to progenitor cells. Okay, it binds to progenitor cells, making these cells capable of what? Differentiation or proliferation. Patay tayo dyan. Ayan na naman tayo. Hematopoiesis is, by the way, I think two chapters in one hematology book that I just discussed, and you can make a lot of questions for that one. Kaya separate yung presentation ko for hematopoiesis, and I think it's an hour-long discussion. Stromal cells. Let's talk about stromal cells next. Next slide, please. Okay, so stromal cells they have like chemicals that comes in and out. No, sorry. Inside the extracellular matrix pala. I mean, extracellular matrix of the cords, there are chemicals present. 7 of them are important in in the whole microenvironment. Okay? Proteoglycans, glycosaminoglycans, fibronectin, collagen, thrombospondin, hemonectin, and laminin. Those are the things that those are the chemicals that maintain that maintain the extracellular matrix of the cords. Take note about take special attention to proteoglycans, because these are not adhesion molecules for HSCs. What are HSCs again? Hematopoietic stem cells. Okay? Hematopoietic stem cells. All of this are basically like chemical adhesion signals, or adhesion molecules rather. Adhesion molecules for specific cells. Okay? We'll go at them one by one when we see the whole image of it. But let's go to the next slide first. Now, the importance of proteoglycans found in the extracellular matrix is the binding molecule for stromal cells to progenitor cells. It's not an adhesion molecule. An adhesion molecule is different from a binding molecule. Okay? To progenitor cells. Okay? Can we see if my answer is correct? They bind to the progenitor cells, the non-stem cell progenitors. Okay? Non-stem cell progenitors. Ibig sabihin, hindi siya yung nagbubuo ng what? Hindi siya yung nagbubuo ng blood cells natin. Okay? It doesn't form blood cells. These are cells that form the osteoblast, osteoclasts. Okay? Kasi parang siya yung regulators. Okay? Now, let's talk about organs. I think that's the next one. Organs involved in hematopoiesis. Okay, this is the primary site of hematopoiesis during the second trimester. Okay? So we're talking about the baby, okay? We're talking about the baby, not the mother. Primary site of hematopoiesis In the second trimester, bilangin nyo lang ilang taon. Kanina sinabi ko na sa inyo kanina, 'di ba? Ilang linggo ang ano. Second trimester happens when? O, 'di ba? Ganon. Anong buwan ko ba inire si ano? Ganyan. 'Di ba? Sinabi ko na sa inyo yung mga ano kanina. Okay? So ano siya? Saan siya magfo-fall? Mesenchymal, hepatic, or may extra medullary? Mark Segi. So where ang primary site sa liver? Very good. Okay. Very good, very good, very good. Sa nanay ha. Ay sa baby ha, hindi sa nanay. Baka kasi ano, baka kasi may hindi ko nga naman tama nga naman tong ano ko. Hindi ko naman ini-specify din, Mark, no. Ako naman yung may pagkakamali this time, hindi ko ini-specify. Pero let's go on to the next slide na kasi we want to move on na. Medyo nagugutom na. Nakikita ko nagugutom na si James Paul eh. Okay. What is the contribution of the liver to hematopoiesis and blood cell metabolism? Blood cell metabolism. Sir, minimetabolize pala yung blood cell? Yes. Yes. Ano ba mangyayari kapag ka nag-hemolyze ang blood? Diba? Magsiseparate siya into... A blood cell contains what? Hemoglobin, right? Hemoglobin needs to be separated into a heme group, which has an iron, right? Which has an iron molecule in it, or I think 1 or 2 molecules of iron. 4 molecules of iron, rather. Okay? The other one is the globin group, right? So, contribution of the liver for hematopoiesis is as follows. It sequesters, it produces hemoglobin intermediates, and it is responsible for conjugation of bilirubin. Okay? Now no more discussion on that one. We don't have a lengthy we don't want to have a lengthy discussion on with all of these things. Okay? Because we have a specific I think you guys have a specific lecture there for clinical chemistry, specifically for the conjugation of bilirubin. So I'm not going to talk about that one. I'm just throughout the whole discussion, we'll come across sequestration and hemoglobin production. Okay? So we won't discuss bilirubin conjugation. But just for your information, the globin chains get conjugated and form bilirubin. Okay? From lysed RBCs. Okay? Now, next, what? Okay? What enzyme intermediates are produced by liver enzymes, by enzymes in the liver? They are collectively known as porphyrins. Okay? Next slide. Porphyrins. Okay? Or porphyrin. Okay? If you have a disease associated with these enzymes, for example, you have a mutation with one of the enzymes that produces these intermediates, ano ang sakit mo? Yung vampire disease. Gusto ko isulat nyo yan. Kasi lumabas yan sa board exam ng isa kong reviewer. I think it was Analea Navarro who told us about vampire disease. And that was one of the questions in her board exam. Which of the following diseases is also known as vampire disease? It's porphyria. Alsin nyo lang yung alsin nyo lang yung NS. Dagdagan nyo lang ng A sa dulo. Porphyria. Okay? That is also known as vampire disease. Why is it called vampire disease? Because when you go out of the sun, a person who's normal, when they go out of in a sunny day, they don't have those bleeding disorder. They don't have a bleeding episode. Okay? Because they don't have those photosensitive porphyrins. Okay? So porphyrins are basically important for us because they don't the cells don't explode immediately. Okay? So a person with porphyria would have what you call allergy to light. If I'm not mistaken, I think it's allergy to light. So yeah, that's the reason why it's called vampire disease. Okay? Now, let's move on to the next slide. The largest lymphoid organ that contributes to hematopoiesis is the spleen. Okay? It is the spleen which is supplied by about 350 ml of blood per minute. Okay? Imagine 350 ml of blood passes through your spleen. Now, I have a question though. Sinaksak ko sa tagiliran si Mark Segi. Kasi hindi siya nakapasa ng exam niya. Okay? Sinaksak ko sa tagaliran si Mark Segi. Mark Segi, hindi ka pwede ka pa rin sumagot, ha? Pwede ka pa rin sumagot. True or false? Natama. Ay, hindi pala. Sinaksak ko sa tagiliran si Mark Segi. Tapos, inoperahan si Mark Segi. Tinanggal ang spleen niya. Kinabukasan si Mark Segi stable na. True or false? Can you still live without a spleen? Yan, alam nyo na kung anong follow-up question ko. I think alam nyo na kung anong follow-up question ko. Pero sige, true or false muna tayo. Can you survive without a spleen? Sinaksak ko si Mark Segi sa tagiliran. Nanggigil ako kay Mark Segi. Pangatlong ano na niya. Pangatlong hematology na niya. Hoy, hindi ka ibig sabihin, pumasa ka nung yung hema ng nung third year. Ikaw naman. Tapos naghema na naman ulit tayo ngayon. O, diba? Okay. Who's answering? Oh, no. We don't have students, Sir Marco. Nobody's answering. True. Ayan. Okay. Let's end the poll with Gracie. Okay? I'll ask Roddy May Samonte. Roddy May, are you there? Pakigalaw ang baso ko, nandito ka. Bakit mabubuhay si Mark Segi kahit wala na siyang spleen? Infection. Ano bang function ng spleen muna natin, Roddy? Sige, Roddy. Ano ang function ng spleen muna natin? Anatomy and Physiology Review. Nakaabot ka ng seminar, ibig sabihin, nadaanan mo ang spleen. Ano ba ang function ng spleen? Yun lang? Yun lang? Okay, yun lang. Hindi ko naririnig yung kailangan kong sagot eh. Yung kailangan kong sagot eh. Kaya tanong ako ng tanong ng yun lang. You're answering everything correctly actually, by the way. Meron akong hindi lang na naririnig pa. I need to hear more. Okay. Call a friend na tayo kay Lilzo. Okay na. Call a friend tayo. Lilzo, sige. Thank you, Roddy. Very good. So, ibig sabihin, vital organ ba siya or hindi? Hindi, 'di ba? Hindi siya vital organ. Pag sinaksak kita tapos tamaan ko yung spleen mo, when you went to surgery and then they closed up the bleed. Hypothetically, if we hit the spleen, right? If we hit the spleen only and no other blood vessels, no major blood vessels, they closed everything and they stitched you up, you will still survive. You'll still walk the next day without a spleen. Actually, mabilisan nga lang recovery niyan eh. Kung hindi talaga ganun kadami yung blood loss mo. Okay? So it's not a vital organ because its main function is mainly for, as Roddy said, she said that first two things. But one of the most important things that it does is to filter RBCs. Siya yung nagsisequester. Okay? Siya yung namimili na pwede pa ba to? Hindi na ata to pwede. Parang imaginein mo siya yung nag-work sa factory as quality control. 'Di ba? Mayayaman sila, hindi nila alam yung mga hindi pa sila nagtrabaho sa factory. Mga rich kids to, mga to. So, ibig sabihin, kahit konting maliit lang na dimple sa ano, actually the spleen is very specific when it's doing quality control with RBCs. For your information, yung maliit lang na dimple dun sa perfect shape niya, kakainin na kaagad ng mga phagocytes sa spleen yon. Okay? So yes, everything that Roddy said was correct. Wala lang yung filter. Sequestration is one of the things that is important, that is done by the spleen. So, kailangan na ni Mark Segi ng continuous na inom ng gamot. Kasi, bakit? RBC niya is extended ang extended ang lifespan, 'di ba? Tas abnormal pa yung iba, 'di ba? So may continuous na gamutan na siya, and also kailangan niya na siguro dumaan ng dialysis. Depende kung gaano ka-severe ang case ni Mark Segi. Tsaka gaano siya kadaming mag-produce ng abnormal na cells. Okay? Clear? Clear? Alright. Lilzo, no, not Lilzo. Marion pala. Marion, please move to the next slide, please. Thank you. Okay, the 3 regions of splenic tissue. Ayan na, di ba? Re-reviewin ko na kayo. Red pulp, white pulp, and the marginal zones. I'll show you a picture from the University of Texas, right? So see, you see white pulps there, right? You see those little white things. Okay, marginal zones are the zones in between B and A. You can see that there's an outline there, right? Clear ba yung outline sa on your side? Kasi sa akin clear naman. Okay. So the red pulp is the red part obviously in that cross section. Medyo kadire, alam ko malapit na mag-lunch time. Okay? Imagine niyo na lang na ano 'yan, na ano 'yun yung kinakain ng yung tatusok-tusok turo-turo, yung may tusok-tusok na ano. Anong tawag doon yung iniihaw? Clotted na blood. Anong tawag doon, Mark Segi? Hindi ko alam. Kalimutan ko na. Betamax. Ayun. Imagine nyo na lang Betamax yun. Na hindi pa naluluto. O hindi pa naiihaw. Thank you, Betamax. Iniisip ko, yung tape. Betamax kasi. Okay, DVD ang nasa isip ko. Okay. Alright. Let's move on to the next slide. So those are the 3 things that the three parts of this slide. The 3 parts of the slide. The 3 parts of the cross section. When you dissect a spleen, you'll see 3 regions there. Okay. Now the next thing that we need to remember is the white pulp. Okay. The white pulp has 2 things. It has lymphatic nodules and periarteriolar lymphatic sheath. Okay. So those are the 2 things on the white pulp. Can we see if I'm correct? Lymphatic nodules and arteriolar lymphatic sheaths. So these are basically where lymphoid cells are transported. The periarteriolar lymphatic sheath. Okay, the nodules also. Okay, now. Next slide, please. Okay, what are the cells found in the following pulp tissues? So each part of the white pulp tissue has the following cells. Lymphatic nodules has leukocytes, both T and B cells, or respectively, macrophages and dendritic cells. And the periarteriolar lymphatic sheaths has primarily B cells. Okay, how did they know this? How did they find out that these cells are found there? They did flow cytometry. They tagged what? The CD markers, diba? They did flow cytometry on that one. That's the reason why they know what cells are found in each. Okay? Baka lang nakakalimutan ninyo na meron tayong technology to identify that one. Okay? We have flow cell cytometry using immunohistochemical stains. Okay? Or immune tags. Okay, next slide, please. In the germinal center of the periarteriolar sheath, it's really a mouthful. What cell is found? We see what? We see activated B cells. Okay, activated B cells. What is an activated B cell? balik tayo sa ano natin, maturation series. Bago ko kayo review muna tayo. Advance lang na review. Paano mo siya masasabing activated B cell? Ano ba ang activated B cell? So, meron tayong naive cells, 'di ba? Ng lymphocytes natin, 'di ba? Mga naive cells. Paano siya nagiging B cell? 'Di ba? Paano siya na-activate? Or ano na lang, para mas madali, ano ba ang activated form ng B cells? Sige nga. What is the activated form of a B cell? What do you call that cell? Starts with the letter P. It secretes antibodies. O, ayan na. Binigay ko na sa inyo lahat. Ayan. Saka na Angelo. Ang bilis magtaas ng kamay ni Angelo no sinabi ko na lahat ng clues. Very good. Di ba? Aside from plasma cells, you can also have memory B cells because they proliferate also. B cells or lymphatic cells are capable of, lymphoid cells are capable of proliferation outside the immature cellular lines. Okay? Now, let's go to the next slide, please. Red pulp is comprised of two things. You have the splenic cords and the sinusoids. Okay? Splenic cords and the sinusoids. Sir, meron na namang cords. Ang dami namang cords. Maglalaro ba ng gitara ang katawan natin? No. Ganun lang talaga. May mga cords talaga sa mga bagay-bagay sa katawan natin. Okay? Now, another name for the splenic cords is the cords of Billroth. Okay? I think that's in the next slide. That's a nice to know question, I guess. I added the nice to know. Right? Yeah, the cords of Billroth. Okay? Cords of Billroth. Ang dami nyo maaalalahanin ng mga pati ba naman pangalan ng mga tao? Billroth. Okay? Cords of Billroth. Next slide. What cells are present in the splenic cords? So, we're talking about the splenic cords, okay? So, each part of the spleen has different cellular populations. When I say cellular populations, kung anong klaseng fraction sila. It would be B cell, macrophages, dendritic cells. But in this case, we're talking about the splenic cords. What cells are present in the splenic cords? It has what? It has macrophages. Okay? And the main function of macrophages is to filter blood. Okay? That's why the splenic cord is the one that is mainly responsible for the what? Yung sinasabi kanina ni Lilzo kanina na filtration. Pero what type of filtration is done? It is sequestration. Okay? Which means it's sequestering everything. Alright? Now, let's go again to the next one. Next one. Okay? What brings about the filtration of the splenic cords? Okay? Okay? Filtration occurs because of decreased blood flow. Okay? Pag mataas ang rate ng blood flow class, ibig sabihin, for example, yung mga high blood pressure, madaming cells nakakalusot. Okay? So, filtration is achieved normally at a slow rate of blood supply, a slow blood flow, okay? Or a decreased blood flow. This results in decreased oxygen supply and decreased glucose. Okay? Okay, para makapag-filter siya. Okay, bakit? What is the reason why kailangan may decrease ng blood flow? Para malaman kung sino yung mabilis, para malaman ng mga splenic macrophages natin or splenic cord macrophages kung sino yung madaling masira. Nagets nyo? Ang galing ng design ng katawan natin, di ba? Mayroong parang mga mechanisms, di ba? Ang galing-galing, di ba? Naisip mo ba yung spleen mo, Mark Segi, ngayon? Kaalagaan mo na siya, Mark Segi, ha? Ikaw din, Patrick, ha? Okay? So, ang galing ng design ng katawan natin, no? So, kaya dinidecrease ang blood flow kasi babawasan yung oxygen supply kasi matagal siyang nasa circulation in that part of the body, right? There's a decreased blood flow kasi it's continuously metabolizing. When these two things are achieved, the human body, the splenic macrophages will detect any of the weak ones. So it's like culling it. What do you mean? C-U-L-L. Walang kabastusan, ha? Mark Segi, misi ka na naman, Mark Segi, kabastusan. Culling. C-U-L-L, ha? Kalokohan na naman, Mark Segi, gumisi ka, Mark Segi, nakita ko. Okay? Culling. Okay? Culling. Ibig sabihin, tinitingnan niya yung parang survival. Even in the cellular level, di ba, may survival of the fittest pa rin. Ang ganda talaga ng katawan natin. Okay? Kaya pasalamatan nyo ang spleen ninyo, ha? Okay? Gusto ko after ng class natin, sabihin nyo sa spleen nyo, tapikin nyo yung spleen nyo. Okay? Sabihin mo, "Hey, thank you." Okay? Lil Zoha, tapikin mo yung spleen mo mamaya. Huwag masyadong malakas. Okay? Ay, yan nga yung itatanong ko. Nabasa mo yung nasa utak ko. Sige, for 1 point. Sige, for 1 point. May healthcare ba itong mga to, Sir Marco? Hindi ko alam kung nag-healthcare itong mga to eh. Sa healthcare, tinuturo yan eh, yung physical examination. Maski sa medtech. Sige, what quadrant, anatomy and physiology tayo, what quadrant do you see can you auscultate the spleen? Taray, auscultate. Yung mga magbe-medisina dyan, dapat alam nyo na. What quadrant? Quadrant 1, 2, 3, 4. Pag may sumagot ng part kung nasaan yung kung nasaan yung appendix, bubula na naman ang bunganga ni Marco Flores. Ayan ang choices ninyo. Auscultate, yung ginagano na. Quadrant 1, 2, 3, 4. Bigyan natin ng 1 minute para i-google nila. Taray. Taray, baka sumagot na. Ang aga ng sagot. Wala pang 1 minute. Ayan na, nagsunod-sunod na sila. Humanda talaga kayo. There is strike in numbers, Sir Manuel. Ibig sabihin yan, pag nagkopyahan kami, there's a high likelihood na hindi ako matatanong. So, nagagets na nila yung sagot. Nanunood sila ng Squid Game. Alam na nila kung paano mag-strategize, Sir Marco. Inaantay lang nila kung sino sasagot ang tama. Okay. Sige. Okay. Wala na? Si Bay lang? Meron pa kayong 45 seconds. Manunood sila ng Squid Game, Sir Marco. Squid Game the challenge. There is strength in numbers. So para tumaas yung chance nilang hindi sila matawag. Magkokopyahan na lang sila at sasagot. Ayan na si Bay, binago din niya. Mm. 30 out of what? Out of 4, baka naman out of 50. Ay my God. Nako. Ilan ang passing rate? Sinong medtech loss tayo? Ilan ang passing rate per exam? 100 items per exam. So, exam 1, 2, 3, 4, 5, 6 ata. Yun or 7? 6. 100 bawat isa. So, ang passing score nun is ilan, Sir Marco? Dapat. Paktay ka diha talaga, day. Pag hindi ka nakaku... Oo. Oo. Sisisihin si anak ko. Nag-rant na si Sir Marco. Ayan. Si Lil Zo kasi eh. Charit. Feeling ko yung parents dito from LA yan yung nag-ano. Charit, nagre-reklamo. Charit. Charit lang. Huwag ka mag-alala, mas maganda mag-medtech dito dyan sa Pilipinas. Huwag ka mag-alala. dito, dito hindi ako ano. Magagaling na yung mga estudyante mo, Sir Marco. Yung mga estudyante dito, no. Hindi ako, hindi ako believe. Hindi nga marunong mag-phlebotomy yung mga estudyante dito. Okay, time's up. Punta ka na ng Saudi. Sa Saudi, pumasa ako doon, hindi ako nag-review. Ang passing rate doon is 35 out of 100. Taray, 'di ba? Oo, 35 out of 100. Pero dapat Saudi citizen ka. Pag Pinoy ka, 60%. 100 items 'yon. 100 items 'yon. Pag gusto mo maging lab specialist, 80. Lab technician yung ano. Wala man pinagkaiba yung lab technician, guys. Huwag kayo mag-alala. Mali lang yung translation. Okay. Okay, so we're done. Tama natin is from right to left tayo. Right to left tayo. You start with the upper right quadrant, upper left quadrant, lower right quadrant, lower left quadrant. So you just put a cross in your belly and number it from 1 to 4. Up right, up left, down right, ganon. Okay? So, the correct answer is number 2. Okay? So, nagbago ng sagot si Bay. Naloka si Bay. Dahil si Bay ang nagpalit. Okay. Puntahan natin si Bay. Tama naman ang sagot ni Bay. Bay. Where is Bay? Meron akong question for Bay. Naloloka ako, Bay. Bay, I have a question for you. What do you call how would you identify somebody who has a problem with their spleen? O, di ba? Clinical presentation naman tayo ngayon. Paano mo masasabi may problema ka sa spleen? General lang. For example, hindi mo na sinasabi mag-doktor ka, ha. Sinasabi ko lang is, for example, may relative ka. For example, relative mo si Patrick. Ano mo si Patrick? Tiyuhin mo si Patrick. Palainom yan si Patrick. 'Di ba? Lakas uminom yan si Patrick, ang laki ng tiyan. Paano mo malalaman na may problema siya sa spleen? Yeah. No. Hoy, 'di ba sinabi ko nga sa inyo ang spleen is not a vital organ. Hoy. Kim, sige, Kim. Hoy, nagjo-jaundice daw. Hoy, liver 'yon. Oh. Oh. O di ba that renders the opposite effect? Dapat normal ang color mo. Dapat red na red ka nga, di ba? Kasi wala nagsisi-sequester. Di ba? Di ba it renders the opposite effect kasi wala nagsi-sequester. Di ba? Ano mangyayari? Kaya ko nga pinakapa sa inyo, di ba? Kakapain nyo. Kim, ganito gagawin mo, kakapain mo pag namamaga yung quadrant 2. Di ba? Malaki yan than usual. Tapos pag masakit. Okay? That's the time magre-request ang doktor ng CBC. Dalhin mo na sa ER, kunwari si Patrick. Okay? Ganon. Okay? Clear? Di ba? Para dun sa mga magme-medisina yan. Okay? Nakuha ko. Would you believe it, Sir Marco? Nakuha ko yan doon sa isa sa student mo, sir. Hulaan mo kung sino. Ano? Sa kanya ko yan nakuha, Sir Marco. Sa student mo na dati mong student na nagme-medisina ngayon sa San Beda. Alright. Okay. Let's go to the next slide. Okay, this is a layer that surrounds the white pulp. The layer that surrounds the white pulp is what? Sorry. Sorry. Inubo ako. Layer that surrounds the white pulp is the what? Kanina sinabi ko na yon. Wala, hindi nakinig talaga. Hindi talaga sila nakinig sa... Ayan, Valiant. Sige. Sige, Valiant. Pakitang gilas ka, Valiant, sa kanila. Anak kita, Valiant. Ano ba yung layer na yun muna? Kasi wala yan dun sa wala yan dun sa slide eh. Nilagay ko yan blank eh. Ano? Nilagay ko yan as blank eh. Ang sinagot ko lang dyan yung second bullet eh. May, may early copy siya ng ano. May early copy siya. Ano yon? Ano bang parts na ano? White pulp? Ano ba? Ano? Tara. White, this is a layer that surrounds the white pulp. Ano tawag dyan? Alam ko talaga, Sir Mark. Ang daling mahuli ng mga students mo, sir. Ano? Mel. Very good. Yun, yun. So the marginal zone consists of what cells? Sinabi ni Valiant. Di ba, Valiant? Oh, alam mo na, Valiant. May early copy siya or nanood siya nung ano, nung previous lecture ko. Those are the only two things that I can that I know how you got the answer. It's either you watched the previous video or you had an early copy of my lecture, which I highly discourage you do. I want you guys to try to answer it without looking at the answers beforehand. Okay, let's go to the answers. Okay, you have to add what? You have to add marginal zones. All right? So the marginal zones comprises of macrophages, specialized B cells, and reticular cells. Okay? Clear? Clear na? Ano? Clear na, Valiant? Okay? Clear? Okay. Let's move on to the next one. Special functions that are done by the spleen, and only the spleen can do this. I think you guys already heard the answer. One of the answers already. It's culling. Okay? Culling. And pitting. Okay? Pitting is a different one. Pitting is removal of inclusion bodies or damaged cell membranes. Okay? That's why you see bite cells. Okay? Are you familiar with bite cells? We'll talk about that when we go to the examination of peripheral blood smears. But basically, inclusion bodies are removed by a healthy spleen. Okay? What are your inclusion bodies? This includes your Heinz bodies, right? Howell Jolly bodies. Okay? What else? Basophilic stipplings, if there are. Okay? Culling is the removal of nuclear material or organelles. Okay? Remaining nuclear material is found in what cell? Oh, yan na tayo. Oh. For 1 point. For 1 point. Which RBC? Okay, which RBC in the RBC maturation, which cell in the RBC maturation series has residual nuclear material? Charan, binago ko na naman yung question. Iba lang yun sa libro. China-challenge ko kasi ko talaga kung carry bambam na kayo sa mga question ko. Kung kailangan ko bang dalian, hirapan, or pahirapan ko lalo kayo. Alam na alam ni Valiant yan at saka ni Mark Segi kung paano ako gumawa ng exam. Which cell in the human body, which cell in the RBC maturation series is found in the peripheral blood with nuclear material? Alam ni Valiant? Parang alam ni Valiant. Pero hindi lang siya nag-raise ng questions. Saka siya, parang dumbfounded yung itsura niya. Ha? Ano yun? Aneklabu. Ganun yung itsura ni Valiant eh. Sabay inom ng tea niya. Oh, Mark, sige na, pag mo napahirapan mga kaklase mo. Ano? Very good, di ba? Retics. Siya lang naman yung merong what? Merong polychromatic presentation pag in-stain, 'di ba? Tsaka may granules using a supravital stain. Saka na natin pag-uusapan 'yun pag dumaan na tayo sa sa hematology procedures. Okay? I have a special discussion for that. Okay? All right. Let's go to the next slide. What blood cells or cell is stored in the spleen? What cells are stored in the spleen? Cells that are stored in the spleen. Cells that are stored in the spleen. By RBC, hindi. Mabagal lang yung daloy, bye. Kakasabi ko lang kanina. Bye. Pag tinanggal ang spleen ni Mark Segi, mas malakas ang tendency niya magkaroon ng bleeding bleeding ano man tawag doon? Bleeding crisis. Oh, Valiant. Tara yan. Pakitaan mo si Renmar. Pakitaan mo si Renmar para alam niya na ikaw ang tunay na anak. Anek? Ay, taray, winner. Palakpakan nyo nga ang kaklase nyo. Para naman tinatry niya talaga ngayon makinig. Tinatry niya talaga ngayon makinig. In fairness talaga kay feeling ko hindi to makakakuha ng suki card this sem. Hinuhulaan ko na. Minsan mali ako manghula eh. So, anyways, let's move on to the next slide. Okay. Yes. So, kita mo ang Junakis. Oh, tama si Junakis. Alright, let's move on to the next slide. Okay, what immunoglobulin class is produced by B cells in the germinal centers of the spleen? Immunoglobulin class naman tayo. Oh. Huwag niyo kakalimutan si Gamed. Diba? Gamed. Ito na ang choices ninyo. Oh. 1 minute on the clock na naman. Iinom lang ako. Grabe naman. IgE daw, sabi ni Nicole. Sige, titingnan natin ang tamang sagot later. Okay? Start ako ng timer ha, class. Naka-mute pala ako. Sorry. Okay. So, time's up. We're ending the... Ilan lang ang student? Ilan lang ang student ko, Sir Marco? Ano ba yan? Sila lang ang students ko. Oo. Bakit si Andrea, si Patrick, si Mark, Roddy, Bai, at Gracie lang ang sumagot? Nasaan si Mel? Nasaan si Angelo? Nasaan si Kim? Hindi sa isa. Si Valiant, hindi nagpapakitang gilas. Inom ng tea. Alright, let's show them the correct answer, Marion. IgM. Okay? So, the correct answer is IgM. Nothing special about it. All you just need to remember is that IgM is present in the germinal centers of the spleen, or in the produced by B cells in the centers of the spleen, in the surface of the not surface in the where was that again? Germinal. Nahirapan ako. Wow na ako eh. Okay. Next, let's move on to the bean-shaped organ that contributes to hematopoiesis. Bean-shaped organ. Pakita natin para alam nila. Pakita na natin para magulantang sila. Nasaan na si Marion? Bang! Ayan. Kulani. Lymph node. Okay? Sa Tagalog, kulani. Okay? Bye ha. Kulani yan ha. Lymph node. Okay, bye. Alright, let's go to the next slide. What are the functions of lymph nodes? There are 3 functions, okay? I think it's almost similar, minus the pitting and culling. Production of lymphocytes, okay? immunoglobulin processing, and filtration of particulate matter and foreign debris. So nakita nyo kaya nga sinabi siya ang war zones. Okay? Nandoon kasi yung ano. Kaya sinasabi ang mga lymph nodes natin at saka secondary lymphoid organs, yan yung mga war zones kasi nandoon nag-i-start ang warlahan. Okay? Now, what are the two types or what are the two regions na tayo of a sorry, next slide pala muna tayo. Masyado ako na-excite. Ayan, o, diba? Production of lymphocytes in the germinal layer, immunoglobulin processing, and filtration of particulate matter and foreign debris. Okay? Now, let's go to the next slide. Masyado ako na-excite. There are two regions of the lymph nodes. Okay? We have the cortex and we have the cortex and the medulla. Okay? So, let's show them the picture. I think there's a picture. Yeah, there you go. So inside, this is a cross-section of a lymph node using H&E stain. This is normal, by the way. This is a normal one. I don't like to put abnormal ones like the ones with cancer. Okay? Para madaling maalala ng mga students. So the cortex is of course the outer layer. It has it's rich in lymph follicles. Okay? Or it has a lot of had a lot of follicular spaces within it. And then the medulla has cords again. Ang daming cords, no? Diba? So the medulla has medullary cords. It's also rich with blood supply and lymphatic fluid supply because it's the space where there's a lot of lymph fluid surrounding it. Okay? Let's go to the next slide. So that picture is just that one. Okay? And these are the two layers. Let's go on to the next slide. B-cell proliferation occurs in which part of the lymph node? Okay? It occurs in the follicular foci or the germinal layer. Okay? Follicles. Okay? Remember there's let's show them the picture again. Two slideshows back. There you go. So the follicles is on the cortex, okay? You see those little circular thingies over there? That where that part is? That's where B-cell proliferation occurs. What is B-cell proliferation, you might say? What is B-cell proliferation? This is where it goes and divides. Okay? Divides. It multiplies. Okay? When it gets the signal from, when it gets the cytokine signal, that's where the proliferation occurs. Okay? Let's go down to where we used to be. Okay? Foci, follicular foci, and the germinal layer. All right. Let's go back. Let's go to the next one. Sorry. What cells are predominant in the paracortex of the lymph node? Meaning it's on the outer side of the cortex, paracortex. Kasi nga hindi na natin pwedeng sabihin outer cortex, paracortex. So the outer cortex has a lot of cells. Is predominantly populated by T cells, while the medulla or the cords, the medullary cords, is predominantly populated by B cells, specifically plasma cells. Can we show them that? Can we show them the next slide? Yes. Okay. All right. Let's go to the next one. Now, this is the fluid portion of blood that escapes the connective tissues. I mentioned that one earlier. Please, can anybody know? Can anybody answer that one? This is the fluid portion of blood that escapes the connective tissue. Nag-intern ka na, Mark Segi, di ba? Mark Segi, nag-intern ka na, di ba? You went on your internship, right? Okay. Have you had a burn victim before? Hindi ka pa nakaabot ng ng New Year's. Sayang. Hindi ka nakaabot ng New Year's. Who here had the patient? Who here went to an internship? Raise your hands. Pag wala, uulit ng internship, di ba, Sir Marco? Pag wala nag-raise ng hand na dati naging intern, uulit ng internship, Sir Marco. Ayan, bigla nagtaas ng kamay. Nasa na yung iba? Madami yun last time, Oo. Nasaan na yung raise your hand if you've already had your internship. Ayoko si James Paul. Lagi lang sagot na sagot si James Paul eh. Si Dexter, bigla nagtaas ng kamay na buhayan ng dugo. Si Dexter bigla. Si Arian muna tayo. Si Arian, kasi parang si Dexter natanong ko na about his sister, Si Arian naman. Arian, Ayan, have you collected blood from somebody who is a burn victim? Oh, nagfe-flebo ka naman, 'di ba? Okay, nagfe-flebo ka naman, 'di ba? Hindi din? Ano, nagflebo ka? Okay. Pag nag-miss ka, ano usually yung na-aspirate mo? Anong color ng blood? Anong color ng liquid ang usually na na-aspirate mo? Clear. Anong tawag dun sa clear na yon, class? Hindi yung tissue fluid. Okay lang, kahit hindi ikaw, Arian. Sige. Pinahirapan na kita. On the spot na nga kita eh. Dexter. Dexter raised his hand. What do you call that clear fluid? Ay, dapat nag-raise ka ng hand mo eh. Hoy! Hoy! Pangalan na nga mismo ng ano, oh. Ayan, oh. Pangalan na ng mga organs sa pinag-uusapan natin kanina. General terms nga yan. Meron mga time primary, secondary. Kayo talaga. Arian. Nakalimutan na talaga nila, Sir Marco. Arian, sige. Very good. Pakita nga natin sa kanila. Very good. Thank you. Lymph. The characteristic of lymph is basically it has no RBCs and it has high protein content. Okay? So, pag meron kang elephantiasis, 'di ba? Bumabara sa lymphatic vessels natin 'yun, 'di ba? Para sa cytology review tayo, kaya lumalaki yung jet logs ng pasyente, 'di ba? Kaya nagkakaroon siya ng elephantiasis. Okay? So, yun yung lymph. Okay? Tissue juice, sir? Hindi ah. Kayo talaga. Tissue juice. Okay, walang juice. Kayo talaga. May mga tissue juice kayo nalalaman. Lymph yung naman. Majority of the, most of the time, if you miss your phlebotomy, and you aspirated the clear fluid whilst you, except lang yung through and through ha, kasi may aspirate ka na dugo dun eh. Okay? Majority of the time, that is lymph fluid. Okay? Alright. Now, let's go to the next slide. I think this has something to do with the pyramid-shaped organ that contributes to hematopoiesis. Oh, okay. I love this organ, by the way. This is a pyramid-shaped organ. Okay. Sometimes it's called as butterfly-shaped organ that is responsible, that contributes to hematopoiesis. This is known as the thymus gland. Okay. The location of the gland is in the anterior portion of the mediastinum. Okay. And in a cat, this is where you find it. It's near the larynx. Okay. That's a dissected cat. By the way, I don't know if you guys have dissected a cat before. When I was a student, I think for biology, for prelims ng biology ay ng ano namin ng anatomy and physiology before we moved to cadavers. We had to dissect a cat and we had to expose everything. Well, arte-arte ni Valiant. Nangangasib yung mukha ni Valiant. Lumalabas yung Ilongga accent ko kahit hindi ako Ilongga. Ano yan? Tama ba yan, Valiant? Yung nagtatrabaho ka sa medical? Paano pag nakakita ka na pupo? Nangangasib din yung itsura mo, hoy? Tama ba yan? Hoy, pusa lang yan. Ano ba kayo? Talaga. Pero baka maano tayo ng pita. So, apologies. These are all for medical purposes. Di ba, Mark Segi? Nagpapaalam talaga ako lagi. Baka maano tayo. This is for medical education purposes or medical technology education purposes. Okay? So, if we seem very insensitive to animal behavior, animal cruelty, that means we're only contributing to science. And I always like to make the discussions a little bit lighthearted with dissecting animals. I know it's not fun for everybody, but whatevs. Let's move to the next one. The next slide, please. The sizes of the thymus gland for adults and children. Sir, tinatanong ba to? No, actually, kaya ako na ngayon sumasagot ng tanong ko. Tinatanong ko lang sa inyo yung mga important ones. Okay? Size difference for adults is actually small. For children, since active hematopoiesis is occurring. Okay? The thymus gland is larger. You might see that in a question like which of the following is true about lymphoid organs, mga ganon. So collectively, I'm just giving you an example of how it will be asked in a question. Okay, what is the function of the thymus gland? Obviously, the reason why it's T cell is it because it is what? It is the waiting zones for progenitor lymphoid cells. Waiting zones for the T lymphocytes. Okay? Next slide ba tayo? Next. Isa pa. Okay? There you go. The thymus gland serves as the waiting zones for progenitor lymphoid cells, specifically the T lymphocytes. Okay? There are two regions of the thymus gland, by the way. Next slide. There are two regions. What are the two regions of the thymus gland? And differentiate the types of cells from each region. So we have again the cortex and the medulla, okay, or the medullary portion, okay. So the cortex has pre-T cells, meaning they are unmarked, okay. The medullary T cells, they're the ones that are marked and are ready to attack, okay. What happens to unmarked pre-T cells if they remain longer in the cortex? What happens to them is they undergo apoptosis. Histopathology review tayo. That one of apoptosis basically means it's programmed cell death. Okay? Histopathology review. It's programmed cell death. Okay? The longer it remains in the cortex, the more and it remains unmarked, the more likely it's going to undergo apoptosis. All right? Now, let's move on to another part of the discussion for hematopoiesis. Stem cells. We're going to talk about stem cells. There are two types of stem cells that give rise to blood cells that we're going to study later on. There's non-committed and undifferentiated stem cells, and there is the multipotent or the multipotential committed stem cells. Okay? These are the two types. Non-committed and undifferentiated stem cells and multipotential stem cells. Multipotential or multipotent or committed stem cells. Remember those ones because in the exams you might encounter this one. Okay? Next. What are the hematopoietic stem cell theories? There are two hematopoietic stem cell theories that that gives us a brief explanation or a theoretical assumption on whether or not whether these stem cells come from or what happens to the stem cells, because there can't be just a stem cell and then it just undergoes proliferation and differentiation by itself, right? Hindi naman pwede mangyari yon. 'Di ba? Mark Segi, hindi man pwedeng basta na lang Mark Segi ka, dapat may pagpapangalan sa iyo yung parents mo, 'di ba? Parang ganon. Okay? So, scientists have postulated that there are two types of there are two theories, by the way. There's the monophyletic theory and the polyphyletic theory. Okay? The monophyletic theory states that blood cells are derived from a single stem cell line. This is known as pluripotential stem cell. Okay? Pluripotential stem cells. For the polyphyletic theory, each blood cell is derived from its own unique stem cell. Okay? The moment the body is capable of producing cells or blood cells in general, there's already a predetermined genetic material that says that, oh, you're going to be a red blood cell, this stem cell is going to be a CSFU, something like that. I think the most acceptable right now is the monophyletic theory, because right now we're doing grafting, skin grafting, right? And I think Valiant has undergone one of the most common practices there before, dermatological practices, right? Stem cell injection sa face para mas maging young. Kasi young na young talaga ang Junakis ko eh, oh. 'Di ba? $10,000 ang isang, ay 10,000 pesos ang isang vial non Valiant. Ang laki-laki ng ano, 'di ba? Okay? So pluripotential stem cells basically means that a stem cell, any stem cell is capable of becoming a blood cell depending on the chemical signals it receives. Okay? Charing lang 'yun, Valiant, ha. Pero sabay tayo nun, Valiant. Pag hindi ka nagkasuki card, ililibre kita, Valiant. Pag hindi ka nagkasuki card, pwede ba 'yon? Gusto mo 'yon? Libre kita nun. Ha? Tag 10,000 tayo ng isang vial, friend. Hati tayo nun, friend. Hati tayo, ibig sabihin yung isang buong vial sa ating dalawa lang. Okay? Tatadta rin para hindi tayo magmukhang matanda. 'Di ba? Ganon. Okay? Next. Now, there are characteristics of stem cells. Parang rabies vaccine. Need may kahati. Yes, sa San Lazaro. Yes. Sir Marco, to, ano hala kita, bigyan ko kayo ng kwento pala. Speaking of vaccine. Kwentuhan ko lang kayo, class. Nakagat kasi ako ng lizard dun sa makulit kasi ako, nag-camping kasi kami sa Saudi Arabia. Nakagat ako ng lizard. Ng butiki na malaki sa gitna ng disyerto. Yung mga malalaking sand lizards dun sa disyerto. So tinurukan ako ng rabies vaccine. Sir, hindi naman nila inubos, tapos tinapon lang nila. Tapos naalala ko nung kakagat ako dyan sa Pilipinas, kailangan ko pa magpunta na San Lazaro. Tapos yung kapartner ko, nakahati ko, galing pa ng Sulu. Grabe, grabe sir, tinapon lang nila, hindi nila inubos. Oo, bumubula na katulad ng mangyayari sa sa iyo mamaya dahil dyan sa mga students. Magkakarabis sa inyo si Sir Marco eh. Okay? Anyways, wala lang. Doon ko lang na-discover, mahirap talaga bansa natin. Kaya kailangan talaga natin kumayod class ha. Alright. Now, let's move on to the characteristics of stem cells. Okay? So stem cells are what? They are capable of self-renewal, they give rise to progeny cells, and they reconstitute the hematopoietic tissue. Okay? They reconstitute the hematopoietic tissue. Basically, they are capable of self-renewal, kaya nga siya ilalagay sa mukha namin ni Valiant. Kasi once nag-adhere siya sa um, germinal layers ng skin, pwede siya maging skin cells din. Okay? They give rise to progeny cells because they're capable of proliferating. Okay? Depending again on the chemical signals. And they reconstitute the tissue of of a host tissue. Okay? So ano ba ibig sabihin ng irradiated host? Have I mentioned how oh no, not yet kasi hindi tayo nakaabot. Transfusion of transplantation of bone marrow, right? So basically what happens if, for example, is you have a rare type of leukemia and one of the experimental procedures require you to become irradiated and then transplanted with bone marrow, right? Let's say Mel is the donor, Mel is the recipient, and Dexter is the donor kasi kayo magkatabi dun sa may ano eh. Wala akong mamili. Kayo magkatabi sa ano eh. So for example, donor Dexter won't get irradiated. Don't worry. Okay. The sample from Dexter will get irradiated, and then in order for you Mel to not exhibit any form of malignancy in the bone marrow, he will get a full dose of radiation. Okay? Full dose naman sa kanya. So ibig sabihin papatayin lahat ng cells sa bone marrow niya. Kasi ibibigay yung bone marrow ni Dexter. What's the importance? Bakit kailangan irradiated? Kasi hindi pa ganun kadami yung antigens ng stem cells. Parang ano siya, parang kalbo pa siya. Imagine, parang kakapanganak pa lang siya na cell. Okay? So once i-transfuse yung stem cells or rather yung bone marrow galing kay Dexter to Mel, there's a lesser risk of rejection. Now, the reason why Mel is irradiated is because we don't want to initiate a immune response against Dexter's cells. Gets you na kung bakit ini-irradiate? Okay? Ngayon, sir, akala ko ba, sir, irradiation kills the cells. Huy, chill lang kayo. Ang stem cells, siya yung one of the characteristics, it's capable of self-renewal nga, di ba? Ibig sabihin parang immortal siya, kumbaga. 'Di ba? Ganon. Kaya yan na ngayon ang trend ngayon sa sa ibang bansa. Okay? Sa ibang bansa may mga stem cell therapy na tayo. Okay? So maybe 10 years from now, isa sa mga manggagamot ko si Valiant. Okay? Blank restoration ang gagawin niya sa akin. Blank restoration. I-injectan niya ako ng virginity restoration also uses stem cells, by the way, guys. Okay? Akala ninyo ha, it uses stem cells also. Akala ko nga dati akala ko pa sisikipin lang. No. Lalagyan din siya ng stem cells to rejuvenate, kumbaga, yung mucosal layers ng Sa babae lang yun, wala sa lalaki. Okay? O, mga boys, wag kayong atsusera dyan. Wala kayong Okay? Alright? Now, let's move on to the next one. HSC na naman tayo. What are the HSC lineages? So there's two types. We have the common lymphoid and the common myeloid. Obviously, when we say that, next slide. Obviously, when I say that, alam nyo na kung ano yung mga end products. Common lymphoid, the end product is what? T cells and B cells. Common myeloid has what? A lot of it, right? Neutrophils, neutrophils, eosinophils, basophils, and monocytes. Correct? Clear? Clear na clear ba? Clear na clear? Or kasama na din pala si macrophages. Si megakaryocytes pala. Sorry. Okay? So pag tinanong kayo, which of the following is not an end product of the common myeloid lineage, alam nyo na dapat. Diba, Valiant? Alam mo na? Okay, very good. Gusto ko yung nagtango lang. Okay? Kasi busy mag-Shopee. Alright, let's move on to the... Uso pa ba yung Shopee dyan? Kasi nung umuwi ako noong 2019, nag-Shopee ako eh. Uso pa yung Shopee? Okay. Eh, yung Lazada. Lazada. Hindi masyado. Taray si Bay ano. Constant consumer si ano, regular consumer si Bay. Taray ni Bay. Mukhang may suki card to sa ano. Hi ha, bye. Okay lang sa may ano ha, okay lang sa Lazada at saka sa Shopee ang may suki card. Wag lang sa seminar ha. Bye. Next year, I want to see Bye next year as a colleague, not as a student. Okay? Alright. Okay. Now, let's go to the next slide again. What are the possible fate of stem cells? Basically, we're predicting what's happening to the stem cells. So, there's three things that occur. They are either going to undergo self-renewal, or they differentiate. That's the second one. Or they undergo apoptosis. Bakit self-renewal? Okay? So, self-renewal basically means it indicates the life of or the lifespan of the stem cells. There's only a certain number of times a specific stem cell can divide, right? And I think if you focused your studies when you were taking a class on cytogenetics, you'll be familiar with telomeres, right? Telomeres are those parts of the chromosomes that seem to get damaged every time a cell self-renews or undergoes cell division, right? And it also indicates the lifespan of the organism as well. In the when you look back at it in the general sense, the telomeres are basically the number of times the number of times the cell can divide, or the length of the telomeres dictate the number of times the cell can divide. Ergo, it also dictates the lifespan of an organism. Okay? So differentiation is something also that happens, or something that is another fate of a stem cell. A stem cell that has been transfused, that has been transplanted, can become another type of cell. Hence differentiation. It could be a blood cell, or in the case of me and Valiant, it could be another skin cell, right? So stem cells are like that. That's one of the things that can happen. And one of the lastly, apoptosis. Okay? So, for example, it reached the maximum amount of cell divisions that it can in its lifespan. There is what we call programmed cell death. Okay? The number of telomeres exceed the number of cell divisions no longer support the subsequent cell divisions, and therefore the cell is programmed or destined to die. Okay? Next slide, please. What are the two types of stem cell division? Two types of stem cell division. We have the symmetric and the asymmetric cell division. Okay? Symmetric basically means it divides because it wants to produce same copies of itself. Okay? Asymmetric is cellular division that has something to do with differentiation. Okay? So for example, stem cell si Dexter. If it's symmetric Dexter, it's going to be medical technology student Dexter that will be another copy. Okay? If it's asymmetric cell division, Dexter becomes what? Dexter becomes a registered medical technologist pag nag-cell divide siya. Gets nyo kung anong difference? Okay? Symmetric, linear. Dexter will become the same copy of Dexter so long as the telomeres support the next or the subsequent cell divisions. Asymmetric has something to do with differentiation. All right, let's move on to the next slide. Enumerate the models of hematopoiesis. Models of hematopoiesis, model as in yung Valiant na model or yung Renmar na model. No. It has some, it basically has, again, another theory. Okay? Has something to do with theoretical understanding of hematopoiesis. The stochastic model. Next slide, please. We have another one. Stochastic model is random differentiation of stem cells that occur at a constant rate. Okay? The stochastic model. Okay? Um, Not widely acceptable, but it kind of explains why some stem cells produce copies of itself. Okay? Instructive means that there are biological signals that determine the fate of stem cells, like the cytokines that I mentioned before, right? Stochastic model is lingering towards what we call malignancy. Okay? This can include leukemia and everything. That's why it's not widely accepted anymore. Right now, the trend is molecular studies. Right? That's why the most accepted one, the most accepted hematopoietic model or model of hematopoiesis is the instructive one, because as science have progressed, we found several signals, or rather biochemical signals, that can determine the fate of a specific cell or stem cell. Okay, now let's go to the next one. Hematologists combined the two hematopoietic models by dividing it into what? They divided it into the initial phases and the lineage phase. Okay? The initial phase is the stochastic model. Random cell division that oftentimes lead to differentiation. Okay? The lineage portion of it, the one that we understand right now, and the one that I think Gwendolyn read earlier, sabi ko kanina, di ba? Repeat that again without looking at your notes. Naalala nyo yun? Yun yung instructive model. Kasi nakikita nyo may mga biochemical signals, di ba? Starting from erythropoietin, blah, 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 sa colony stimulating factor, CSFG or CSFGM. Those are the signals that I'm talking about. Okay? Now, let's go to phenotyping. Okay? Stem cells again. Next slide, sorry. So still talking about stem cells, but this time we are talking about the phenotypes. Okay? This has nothing to do with the RBC phenotyping that we mentioned last week. Okay? This has something to do with the markers that can be seen in stem cells. Now, the youngest or the earliest stem cell marker is CD34. When I was a student, this was a question that seemed to pop up every time I was taking an exam in hematology. Didn't know why, but I think my professor wanted to keep asking that question. Okay? CD34. Okay? All right? So what does CD stand for again? CD stands for what? Anybody? Mark. Parang alam ni Mark. Na-google ni Mark eh. Nakita ko yung ano eh. What does CD stand for? No, cluster of differentiation. Cluster. Thank you for answering. The effort is well recognized. Pakipalakpakan naman kahit na mali yung sagot, 'di ba? Parang tulog na kasi yung mga students ko eh. Tama ba 'yan? But parang talagang si Patrick lang talaga may bromance talagang, there's a bromance brewing with these two. Okay? All right. Next. Beshi. All right, next. Next slide, please, Marion. The loss of stemness is marked by what CD marker? Loss of stemness. Ibig sabihin, nag-i-start na siya mag-differentiate into another cell. Okay? The loss of stemness. Okay? Hindi na siya stem. Kaya nga may apostrophe. Diba? CD38. Okay? CD38. Paano ko maaalala yan, sir? Ang sakit sa ulo. Huwag kayong mag-alala. Dagdagan mo lang ng 4. Diba? CD34. Dagdagan mo lang ng 4. Oh, ayan na. Ibig sabihin, ay, umaangat na siya. Diba? Ganun mo maaalala yan, Valiant, ha? Diba? Huwag mo kakalimutan. Paano mabilisan lang, Valiant. Kasi ikaw yung mabilisan lang. How do we remember again your embryonic hemoglobins nga? Naku, nakalimutan. Ang hirap talaga. O sige, mabilisan. 5 seconds. Raise your hand if you know. If you know, mabilisan lang. Para matest ko lang kung talagang may nakakaalala ng mga shortcut ko. Walang nakakaalala. Nakalimutan nyo yung easy gaze agag. Di ba? Di ba? Easy gaze agag. Di ba? Goer 1, goer 2. Portland. Kayo talaga nakalimutan nyo na. Anyways, ito na naman yung isa sa mga ko. Hopefully makatulong sa inyo. CD34 is the earliest marker. And then the loss of stemness, meaning it's about to undergo differentiation, is CD38. Kasi nga nag-level up siya. Dinagdagan mo lang ng 4. Diba? 34. Diba? Para hindi nyo makalimutan, class. Ayokong nahihirapan kayo kasi memorize kayo ng memorize. Ang dami nyo pang memorize. May mga pangalan pa ng mga bacteria. Diyos ko. Erysipelostrix rusopathiae. Diyos ko. Ano ba yan? Diba? Corynebacterium, ureolyticum. May mga ganon. Ang hirap-hirap kaya. Kaya gusto ko pinadadali ang mga buhay ninyo. Hindi yung mabilis mamatay, ha? Pinadadali ang buhay. Kayo talaga. Okay? Now, let's go to the CD markers for committed. Ibig sabihin may commitment na siya. Okay? Hindi na siya CD34 at hindi na siya yung ready na. Ready na ako. May CD38 na siya, 'di ba? May CD38 na siya, tapos may myeloid markers pa siya. Okay? May myeloid markers pa siya. Okay? Ibig sabihin, alam na natin siya na magiging progenitor. Ready na ako maging myeloid series. Hindi pa natin sure kung anong member ng myeloid series. Pero CD38 plus 33. Okay? Yan. Okay? 38 and 33. Kita nyo hindi nawawala, 'di ba? The loss of stemness nga 'Di ba? Lagi nandiyan si 38. Okay? Hindi ko na alam kung paano nyo mamememorize yan. Basta somewhere around the 30s. Somewhere around the 30s na lang. Somewhere around the 30s. Again, itatanong ko yan sa inyo as a question. Okay? Naalala mo, Sir Marco, yung mga question ko dati, di ba? You are working in a clinical laboratory. You are working in a research facility trying to develop a cell for blah, 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 blah. Di ba may mga ganun ako mga questions, Sir? Oo. Yes. And that's only like 2 items yung makukuha nyo doon sa isang page na yon. Ganun yan. Hindi ko alam kung nabigyan ko na ng question na ganun sila Valiant at saka si Mark Segi Pero ganun talaga ako magtanong ng question. Mga situational na has been working as a clinical laboratory scientist for a research facility. One of their target cells is the youngest stem cell. Mga ganong kemerut. In order for Dexter to isolate a specific population of the cells using flow cytometry, which of the following CD markers should he be aware of? Mga ganong kemerut. Hindi yung, which of the following is, hindi ako ganon. Ayoko na, gusto ko pinahihirapan kayo at nag-iisip kayo. Okay? Ganon. Alright, next. Let's go to the lymphoid markers naman tayo. Ayan. Lymphoid markers, madali lang maalala. Bawasan nyo ng 20. Makakakuha kayo ng somewhere around the 10s. CD10 kasi at CD38. Tingnan nyo, nandyan pa rin kasama si CD38. Next slide, please. No. Next slide. Medyo inaantok na ata si Marion kasi hindi na rapid yung response. Carry ka pa, Marion, or pwede na mag-break? Carry ka pa? Carry pa yata. Hindi pa nag-react Okay. Alright, sige. Tapusin lang natin tong na to. Okay? Next. Let's talk about the cytokines that are present in hematopoiesis or involved in hematopoiesis. We have CSF. Hoy, hindi yaan cerebrospinal fluid, ha? Ano yung CSF, Mel? Ano yung CSF? What does CSF mean? The cytokine CSF. Ano daw? Nako. Ayoko si Mark, si Patrick na naman, yung nagbo-bromance, yung nagbo-bromance, yung nagbo-bromance. Patrick. Okay, ano yung si SCF? Talagang proud na proud si Sir Marco, oh. Proud na proud si Sir Marco. May suki card ba yan, Sir Marco? Kasi parang iba yung ano eh, iba yung closeness mo kay Patrick at saka kay Mark Sege at saka kay Valiant eh. May suki card ba yan? Nabigyan na din ng suki card yan. Kilala ko yung mga student ni Sir Marco na ano eh, na may suki card. Kasi pagka ano, may certain level of rapport na, yung I trust you to fail me because I know I'm effing up. ganun, ganun yung ano yung ano ni Sir Marco. Na I realized that over the years na naging ano ko siya, naging teaching partner ko siya na ano, pag may mga student siya ng mga repeaters, hindi galit sa kanya. Alam mo yun, kung galit sa kanya siguro lumipat na ng ibang ano, lumipat na ng Fatima. Ganon. Pero sa kanya napansin ko every time mabait sa kanya yung mga student, hindi pala sagot sa kanya, hindi pa balang pag tinatanong ni Sir Marco. Kaya I appreciate that you guys understand that he is doing his job to teach you guys, 'di ba? Alam mo, oh no, I am a mess. Ganon, I am a mess. I understand why he gave me the grade. Ganon yung, para child, I failed this grade because I know I failed it. He showed me everything. I'm not gonna lie. I was partying yesterday. Ganun. In fairness, no, merong speaking merong certain level of rapport. Hindi galit eh, walang halo ng puot, Sir Marco, yung ano, yung mga students mo sa iyo, no? Oo. Kay Matulak iba eh. Iba yung kay Matulak, Sir Marco. Kay Matulak iba eh. Grabe yun, sir. Ganun yun si Matulak. Grabe yun, sir. Kakabwisit yun. Toot! Toot! Di ba? Alright. Oo. Anyways, let's move on to the next slide. Okay, so yan. Tama naman, Stem. So, kita mo, proud na proud sa'yo si Sir Marco kasi tama yung sagot mo, di ba? Di ba? Pero hindi ko naman itatanong yun. Alam naman natin lahat yun, di ba, ma? Di ba? Siyempre, mahirap yung tatanong ko. Alright, next slide, please. Okay, so what colony stimulating factor and interleukin is needed for megakaryocyte colony formation? Colony formation basically means CSFU megakaryocyte. Okay? CSFU mega. Okay? Pag nakita nyo sa mga books niyo yon, CSFU, colony forming unit, mega, ibig sabihin, megakaryocyte siya. So, there are two things that you need to remember. It requires the CSFG because it's still a granulocyte, okay, in its younger forms or in its younger years, or rather it's in its younger forms. Okay, and it requires interleukin 3. Mapapansin nyo, maririnig nyo lagi si interleukin 3 na yan. Okay? Especially when it involves proliferation of cells. Okay? Can you see the slide if I'm correct? Interleukin 3 and CSFG. Sir, paano mo na-memorize to, sir? Well, aside sa ilang beses ko na itong tinuturo pa ulit-ulit only, I always, hindi ko alam paano ko ba siya ginawa. Pag naliligo, meron ako dati nung nag-aaral ako, pag naliligo ako, may mga post-it notes ako sa sa banyo. So every time na napapadaan ako, parang I normalize na, okay, ito yung lagi kong dadaanan. Parang ganon. I mean, I don't have photographic memory. For all I know, I'm the most, my memory is that of a goldfish. Okay? Yung parang 5 seconds lang wala na. Ganon. So I try to make an effort na may mga mental cues ako na kung saan ko sila makikita. Okay? So akin, naalala ko yung mga interleukins ko, nakalagay yun sa banyo. Third tile. Sa third tile, nakalagay yun sa third tile. Yung mga interleukins yun, mahaba yun na madami yun na third tile from the very bottom yun. Habang jumejerbox ako, nakikita ko yun lagi. Okay? So, ganun yun. Ganun. You have to make it an effort to normalize that you're going to memorize things. The faster you accept that you're going to memorize a lot of things, the more likely that you're going to find some way during these times that you're reviewing, not only for the exams right now on your seminar, but also for your other exams, like if you want to go to the other to if you want to practice RMT and then ASCP and wherever you want to go. Okay? So yon. Sir Marco, ikaw, anong tip mo? Mm. Yeah. It is so not. It is so not. Yeah. Mm. Yeah. Mm. Okay? Kaya babalikan ko yung complement pathway pag nag-discuss na kami. Nasaan na yun si ano? Saan na yun? Yung mga barkada ko. Dalawa yun eh. Feeling ko masaya kasama yun sa sanggipsalan yung dalawa. Nasaan na yun? Nandito ba yun ngayon? Yung dalawa, yung mga friends ko na yun. Ililibre ko din ng ano. Meron akong dalawa dati na student eh. Nagtulungan sila. Si Aubrey yata yung isa. Audrey. Si, oo, yung mga ano ko yan. Silang dalawa, pag hindi sila nabigyan ng suki card, tas umuwi ako ng Pilipinas, lilibre ko ng samgyup yan, dalawa na yan. 'Di ba? Kaya kailangan ipag-pray nyo na makauwi ako ng February, ha? Okay? Madami akong ililibre, Sir Marco. Baliw. Wag ganon. Ano ba? Ang saya-saya kumita dito. Dalawang OT lang. Dalawang araw lang ng OT. May iPad Pro Max na ako. Di ba? 1 terabyte pa, Sir Marco. Ano ba? Chill lang kayo. Makakamit nyo din yan. Di ba? Ang taas ng sahod ng medtech, no? Diyan sa Pilipinas, buong buhay mo, buong buhay mong pag-iipunan. Naalala ko yun, may nabalita pa yun. Yung parang ano, inipon niya daw from 2015 para lang makakuha siya ng ano ba yun. Basta may nabalita na gano'n. Tapos dito, ay naku, 2 araw lang na OT. 'Di ba? Ganun. Okay? Anyways, tama na yung pag-flex ko. Tama na yung pag-flex. Let's move on to the next one. So, interleukin 3 and CSFG. Okay? Alright, let's talk about the other name for stem cell factor. There's another name for stem cell factor, and that is known as the KIT ligand. Okay? And it has a receptor. Okay? The KIT ligand has a receptor. Um, this is known as c-KIT. Okay? That's seen in the cells of in the cell surface of stem cells. Okay? So, huwag niyo kakalimutan yung KIT ligand na yan kasi parang recently lumalabas na siya ngayon. Parang recent finding lang siya. If you look at the newer books, you'll see KIT ligand is always being discussed. It is just a cell receptor for many of the cytokines or biochemical signals that we're going to talk about. You'll see it appear over and over again in the subsequent slides. Let's go to the next slide. What cells expresses SCF receptors? These are known as your hematopoietic stem cells or HSCs. Okay, so always don't forget HSCs are the only ones that expresses in hematology. Okay, there are other cells in the human body that has SCF receptors, but especially the skin cells. But in this case, in hematology, in hematology, SCF receptors or the KIT ligands are found in, or the c-KIT is found rather, c-KIT is found in hematopoietic stem cells. Gusto ko ngayon pa lang, nagdo-drawing na kayo ng bilog, labelan nyo siya, nakalagay stem cell, tapos idikit nyo doon sa gilid, c-KIT. Mag-drawing kayo ng bilog na maliit sa gilid ng malaking maliit. Okay? Malaking maliit. Mag-drawing ka ng malaking bilog, tapos isang maliit na bilog sa gilid. Lagay nyo sikit. Kasi ito na tayo. Dito na tayo, mag-uumpisa na tayo ng drawing. Okay? Now, let's go to the next slide. This is another cytokine that acts much earlier than SCF. Another cytokine is your FLT ligand. FLT ligand. The FLT ligand is specific for the proliferation of T cells and B cell progenitors. Okay? T cell and B cell progenitors naman siya. If it has an FLT ligand, it's more, if you see that somewhere, know that it has something to do with the lymphoid series. Okay? Lymphoid series talaga, sir. Parang ano lang, parang may starting ano lang, mga start. Imagine niyo lang si Sikit as a starting kit, starter kit, ganon. Kaya nga Sikit. Okay? Now, let's talk about the next one, the next slide. Interleukin that is considered as a multi-lineage cell factor. Tatandaan nyo, wag nyo kakalimutan, interleukin 3. Lagi nyo maririnig yan si interleukin 3. Okay? Proliferation, lagi. Okay? Interleukin 3. Tandaan nyo na ha. Mag-drawing na kayo dyan. Isang malaking bilog, lagay nyo as label niya HSC. Maliit na bilog, kadikit ng malaking bilog, lagay nyo na sikit. Drawing kayo ng isa pang malaking bilog, lagay nyo HSC. Drawing kayo ng isang maliit na bilog, lagay nyo sikit. Dagdagan nyo ng triangle sa gilid, FLT3, lymphoid series. O di ba? Ang dali-dali. Mamaya drawing ko para sa inyo. Baka mamaya hindi nyo nagigets eh. Mamaya wag kayo mag-alala. Okay. Now, let's talk about lineage-specific hematopoiesis. Okay? Let's illustrate erythropoiesis first. Can we show the next slide? Ayan. Oh, di ba? Nakakaloka, ang dami. Nakita nyo, GM siya. Kita nyo, GM. Okay? CSF, colony stimulating factor, GM. Di ba? Granulocytic, monocytic. Okay? So, ano pang additional? Interleukin 3. Nakita nyo? Interleukin 3. Okay? Kasi kakabit si Sikit, ang kakabitan, before this line goes, before it becomes BFUE, there's a stem cell, right? CD38, right? It lost its stemness, right? It lost its stemness. It will receive, it has a c-kit within it, and the c-kit basically is a receptor for the CSF, okay? And the interleukin 3, okay? Now, if that CSF has GM, that means that it can either be an erythroid or a myeloid or a monocytic organism, cell. Okay? Now, in this case, because we're talking about erythropoiesis, from the name itself, erythropoiesis, RBC production. Erythro is red blood cell production. Okay? You start first with the youngest cell in the youngest non-normoblast cell. Tandaan nyo, a non-normoblast stem cell that is known as BFU. Who here knows what's BFUE? Tingnan nyo yung mga subsequent tingnan nyo yung subsequent cells. Erythroblast red blood cells. Ano bang other name ni red blood cell, ni mature red blood cell? Normocyte, di ba? Ano ito? Blast forming unit. Okay? It's a blast forming unit cell with a marker for E. Ano ba yung E? Erythroid series. Okay? Blast forming unit, erythroid. So, ano ang kailangan niyang signals? Okay? So, still, it has c-kit. Okay? c-kit will bind to IL-3, interleukin 3, plus EPO. What's EPO? Again, Mark Segi? Okay. Next, tanungin natin yung kabromance mo. Patrick, where does erythropoietin come from? Very good. Okay? So when these two cytokines bind to BFUE, it will initiate the production, or it will cause the cell to differentiate to a pro-erythroblast. This is the time that you will consider it as a committed erythroid erythroblast. Okay? Committed erythroid stem cell na siya. Okay? Now, mawawalan siya ng ligand. Okay? Because it already transformed. Okay? It already differentiated into another cell population. All it needs is erythropoietin na lang. Kasi hindi na kailangan ng interleukin. 'di ba? And then that goes into the series of events where it becomes a red cell. Alam ko madami pang stages in between, but just for your information, a proerythroblast eventually becomes a red cell because of the help of EPO. Okay? This is just a shortened version, okay? I just wanted you to see how those things that we discussed previously put in activates the differentiation process. Okay? Gets nyo na, class? Gets? Carry pa ba? Sunog na ang, sunog na ang shutak. Carry pa? Okay. Let's move on. Let's move on to the next one. Ayan na, pinatranscribe ko na. Sinong makakaulit? 5 minutes ago ko lang sinabi. 5 minutes ago ko lang sinabi, ha? Ayan na, Lilzo. Erythroid. Okay? Okay, erythroid. Okay. Thank you. Now. Now. Progenitor cell after BFU. Okay, so there's two types of things that you need to remember. Progenitor cells after BFU is the CFUE, colony forming unit E. Okay? And how is it different from BFUE? So in between the balik tayo dun sa pangatlo, before yan. Balik tayo dun. Isa pa yan. Before maging pro-erythroblast, magiging CFUE muna siya, colony forming unit E. Okay? So BFUE and pro-erythroblast, in between that one, you'll see CFUE. Okay? Clear? Okay, balik na tayo doon. Alright. Okay, next slide pa. Alright. Okay, so BFUE and CFUE are almost the same. They cannot be differentiated using a stain, okay, or any type of cytochemical stain. You need to use immunohistochemistry. Okay, it becomes CFUGEM, GEM, GEMM. Okay, but we're only interested in the E. Okay, so tanggalin natin yung E doon sa CFU na yan. So that's why it's CFUE. Now, to differentiate the two, scientists found out that BFUE has a high proliferative activity and low erythropoietin receptors. Bakit? Ano ba ang function ni erythropoietin? To transform it to, or cause it to differentiate to the red cell lineage. Kaya onti lang muna kasi ang main function niya, kaya nga blast forming unit is to proliferate, para dumami. Yun ang main purpose niya. Okay? Para dumami. So scientists have postulated that its main purpose is not to produce cells specific to RBCs, but more so on providing numbers, especially in the cases of hypoxia. How does hypoxia occur? Bleeding. Diba? When you are suffering from anemia, a patient is suffering from hypoxia first. Okay? Diba? Now, onti ang APO receptors, di ba? Ngayon, once it differentiates to a CFUE or the CFU gem nga na yan na sinasabi, it will decrease the activity of its proliferation. Okay? And it will now be much more receptive to erythropoietin. Therefore, it's more focused on producing RBCs. Gets? Gets nyo kung bakit biglaan na lang dadami yung RBCs natin? Or bakit biglaan na lang nagsisilabasan? Sometimes nagkakaroon pa nga ng overflow, nagkaka-spillage, kaya puro retics. Dumadami ang retics ng mga patients natin. Nagets nyo na? Are you piecing it together, guys? What's happening? Okay? Hopefully, you're piecing it together. Alright, next. Let's move on to the next slide. Now, what is the shape of BFU when studied in vitro? Actually, this is not very important. This is not, I've never seen it answered in, I've never seen somebody ask this question or state that they've been asked this question. But just for your information, it looks like a cluster of grapes. Let's show them the picture. This is actually what it looks like. And we're not really sure if it's actually BFUE. Because for all we know, the CFU gem can look like that. The only reason we know it's BFUB is because somebody said so. But if we really want to know what it is, we need to study the what? erythropoietin activity, as well as what? As well as, kakasabi ko lang kanina, proliferative activity. Okay? Clear? Clear? Clear ba? Because I'm gonna ask that in a question. How does one differentiate? Ano mga ganon? Okay? Okay, next slide. What is the cytokine signal for megakaryopoiesis? So ano naman ang pinuproduce natin dito? Dexter. With this kind of with this type of hematopoietic activity, what is the end product of megakaryopoiesis? Kakasagot lang kanina. Very good. Another name for platelet, Lilzo. Lilzo, what's the other name for platelet? Baka malito ka sa exam, palitan ko, 'di ba? Baka malito ang iba para hindi kayo magulumihanan. Ginagamit natin yung mga other names na 'yan. Ha? Malay nyo, tinamaan ako ng pulog. Instead na erythroblast ang gagamitin ko, gagamitin ko ano ba 'yon, yung normoblast, ganon, paiba-iba, 'di ba? Para sumakit yung ulo ninyo. Tapos dun sa choices din, maturation series, iba-iba yung pangalan. Erythroblast, normocytic polychromatophilic, yung mga ganon-ganon, instead na retics. Naluka yung mga, hindi naman ako ganon kasama. Huwag kayong mag-alala, hindi naman ako ganon kasama. Thrombocytes, okay, thank you. Alright, so, cytokine signal. Let's talk about cytokine signal. So again, ano ang kasama niya? Multilineage. Ano yung kauna-unahan nating iisipin kapag cytokine signal? Interleukin. What number? Patingin nga sa mga camera, itaas ang mga daliri para malaman natin. Wait, titingnan ko muna kung ginawa ba. Ginawa nila lahat, pati si Renmar, taray ni Renmar, nakikinig si Renmar, hindi puro pa beauty ngayon, di ba? I'm so proud of you, anak. Yes, it's we call this, it's interleukin 3. Okay? So, it's interleukin 3. Now, huwag kakalimutan pag megakaryopoiesis, it includes interleukin 11. Ano ba yan, sir? Meron na naman interleukin 11. Okay? Interleukin 11. Pero much more important is TPO. Okay? TPO. Those are the 3 cytokine signals that you need to remember. Now, para lumabas sa bone marrow ang megakaryocytes natin from CFU mega. Ayan na mega, 'di ba? Naalala nyo kanina sinabi ko mega. Okay? So from CFU mega, it will become a megakaryocyte. It still has its own stages. In between those stages, you'll have the megakaryoblast, blah 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 blah. We'll talk about that sometime later. Essentially, it will become a megakaryocyte. It still has the same activities as the one before earlier. It's much more receptive this time to TPO. Okay? So, the reason why as a megakaryocyte will be forced to go out is because of another chemical signal, and that is TPO. Okay? What is TPO na naman? Sir, ano naman yung TPO na yan? Thrombopoietin lang yan. Huwag kayong ma-stress. Okay? Thrombopoietin lang yan. Ang ma-stress kayo yung paano nyo maaalala si interleukin 11. Okay? Doon kayo ma-stress. Kasi ubus na ang wittiness ko, class. Ubus na. Class, ubus na. Hindi ko na alam kung paano nyo ma-memorize. Yung goer 1, goer 2, goer 3, naaalala mo pa, Lilzo? Naalala mo pa? Okay. Dexter, naalala mo pa ang goer 1, goer 2? Okay. Huwag nyo kakalimutan si Valiant. Pakipasalamatan si Valiant mamaya. Ha? Okay. Let's go to the next slide. Another name for TPO is thrombopoietin, or another name, or what we call the MPL ligand. Sir, ano na naman yung MPL ligand na yan? Meron na nga tayong c-kit. Meron pa tayong FLT3. Meron pang ligand. Ako, class, lahat yan nandoon yan. Every time na jumejerbax ako, nandoon yan sa may pangatlong tile. Kaya you have to make a conscious effort on how to remember, when to know your weaknesses. Okay? Kung hindi ka magaling mag-memorize pero magaling kang mag-analyze, then try to make a conscious effort on how you can memorize these things. Okay? Because it really requires memory work. I'm sorry to say. Okay? Now, let's move on to the next slide. Okay? Cytokine signal for monocytes and neutrophil production, or what we call the granulopoiesis na tayo. We're starting granulopoiesis with monopoiesis and neutrophil granulocytic series. So there's a cytokine signal for that one. It's again CFUGM. Okay? CFUGM or CSFGM. Okay? Sorry, cytokine signal is GM-CSF pala, colon stimulating factor. The cell that will receive those messages will be CFUGM. Okay? Don't mix up the two. Okay? Like what I did a couple of seconds ago. Alright? So the interleukins that you need is again interleukin 3. Papansin nyo, interleukin 3. Madali lang tong madali lang sa monoblast at sa myeloblast class. Tingnan nyo monocyte lang, monocytic and granulocytic CSF lang. Madali lang class. Hindi kayo pahihirapan. Walang number ngayon. O, diba? Okay? So, clear? Clear kung ba anong pinagkaiba nung ano? Okay. Let's move on to another one. Cytokine signal for eosinophil production. Cytokine signal for eosinophil production. Eto na. Pinag-usapan natin to with hypersensitivity type 1. Diba? Hypersensitivity type 1. Ano ang kailangan na signal? Kalimutan na nila. Class, nakalimutan nyo na. Number 5, di ba? Interleukin 5. At ano pa? Ano pa? As usual, kasama pa rin si number 3. Very good. Pero, wag kakalimutan ha. Granulocytic, monocytic, colony stimulating factor. Okay? Magkakamali kayo kapag ano lang. Okay? Interleukin 3. Okay? Clear? And interleukin 5. Okay? Okay? Clear? Clear ba? Okay. Now, let's go down to the next one. For basophils. Okay? So, for basophils, bawasan nyo lang ng isa. Yung sa eosinophil. Kaya nga lagi nilang dinidiscuss, di ba? Pansinin nyo, class, every hematology book, you'll see neutrophil, eosinophil, basophils. Tingnan nyo, pansinin nyo, every book na titingnan ninyo, laging ganun ang order. Kasi class, tingnan nyo yung mga interleukins. Magkakasunod ang number. 3, 5, and what? 3, 5, and 4. Diba? Huwag yung kalimutan. Tingnan nyo, in order siya lagi. 3, 4. 3, 4, and 5 pala. Sorry. 3, 4, and 5. Kita mo na, nahahawa na ako sa mga sa mga serologist. Hindi marunong magbilang. Diba? Tingnan nyo, ganyan lagi yung order. Okay? And it took me a long time to find the pattern. And as human beings, we're always looking for patterns in life, 'di ba? O, ayan na ang next niya. Pakita na natin. Marion. Oh, 'di ba? 4 naman siya. Okay? So ilagay niyo lang sa notebook yung sunod-sunod. 3, 4, 5, 'di ba? Neutrophil, basophil, eosinophil. Okay? Ganun yun lang siya. Hindi kayo magkakamali sa mga interleukins. Ganun yung naka-drawing sa third tile ng banyo ko. Okay. Okay. Next slide. Wala na. So that's the end. Alright. So, natapos na tayo sa hematopoiesis. Next naman natin is the RBC series. Okay? We're going to talk about the RBC, the hemoglobin, everything about it. But we need an hour. I think, what time is it there in the Philippines? Alexa, what is the time in the Philippines?
In Philippines, it's 11:33 a.m.
Ay, tamang-tama, lunchtime, class. Lunchtime. Okay? So, let's go with 30 minutes. Okay lang ba yung 30 minutes or 1 hour? Hindi, 1 hour, sir, 1 hour. 1 hour. 1 hour talaga, Patrick. Who here wants to go with 30 minutes? Raise your hand if you want to go with 30 minutes. 30 minutes lang si Marco Flores. Majority wins. Sorry, siya ang dekano ninyo. Wala kayong magagawa. 1 hour? Okay, sige. Oo. Saya ni Patrick, oh. Alright, so 1 hour. I'll stop the live stream. I'll entitle it as Hematopoeisis whilst cooking whilst I'm eating dinner. Anyways. Okay. All right. Any questions? Do we have any questions? Now is your time to ask questions. Ayan na. Patay tayo dyan. Sana masagot ko. Mark Segi. Naku, patay tayo dyan, Mark Segi.